10, 9, 8, 7, 6, 5, 4, 3, 2.
Good morning. All right. I would like to thank you all, the early risers that took some time to get here this morning. All right. I know getting an early start and getting energized for this important topic is always a great thing to start your Friday and for the work at DeKalb County. I'm Damon Scott. I'm the Human Services Director for DeKalb County, and I would like to welcome you to It Takes a Village, a town hall conversation on homelessness in DeKalb County. Before I get started, are there any elected officials here this morning? Okay, welcome and thank you for being here. I would also like to thank Commissioner Patrick for his leadership in convening this very important town hall. I would like to thank Ms. Kelly Appel and her staff here at Mercer University for allowing us to have this town hall on this beautiful campus. Dr. Jeff Bailey, who had to travel in as well, who will be our moderator, for coming all the way from Washington, D.C. to be here with us today, and all the speakers who you will meet during these panel sessions. And of course, I want to thank you all for being here this morning. How Human Services became part of this initiative. If some of you all, I'm sure you all remember, about 2 years ago, there was a deep freeze, right? And the temperatures were constant below the 30s in DeKalb and other parts of the metro region. In that, there was a public safety response in DeKalb County that was also part of our community development leadership and COO Zach Williams' leadership, where we had to utilize other facilities within the county to help our unhoused populations. In that response, senior centers were utilized, and senior centers fall underneath my purview. And so in that, we learned a lot to get through that winter season 2 years ago, and it was quite of a challenge. But we also learned that it takes a coalition, it takes wraparound services, it takes a holistic, comprehensive approach to really come up with solutions for those that are experiencing homelessness and are temporarily unhoused or permanently unhoused. And we saw several thousand people this past winter in our senior center in Chamblee in North DeKalb. We also know that we saw youth and other individuals that had a myriad of challenges that was leading to the instability. And so I want to thank everybody that was part of that effort, everybody from our administration, CEO Thurman, COO Zach Williams, Director Mitchell, who you'll hear from later, and an extension to Frontline Response, Terry Tucker, who was part of it for this year's solution, to help us, and all the others, the volunteers, the City of Decatur, and that collaborated several workshops and discussions along that way with many of the nonprofits and others in the area. Also, our public safety team and our human services staff. I'd like to say thank you all to help us for all the help that you have provided for the unhoused community here in DeKalb County. It was with compassion that we were leading, and with compassion that will stay with us as we move forward in the discussion. Today's town hall, just a little overview, is we're going to be looking at factors that are contributing to the homelessness, such as increased rent, mental illness, low wages, lack of affordable housing. The town hall is designed to start a conversation on how we can effectively collaborate to deal with these challenges in DeKalb. The first panel will take a look at current homelessness that is contributing to the increase in homelessness. We will explore trends and ways in which homelessness can be addressed in the county. The second panel will discuss current housing and homeless services that are offered in the county. We will explore successes that are working for service providers, as well as the challenges that they face. Finally, we will explore the integrated systems and other solutions that will help bridge the gap and assist in those that need local service providers. Finally, the third panel will look at strategies. It will also be discussions around policy and ways to have Q&A to engage and have further questions to bring us further along the continuum of care that's needed to provide for this population. A box will be on a table right over here next to our moderator, Dr. Bailey. And so I look forward to all of the contributions that you all are going to provide. But next up, I would like to introduce the person that made this all possible, Commissioner Robert Patrick. And I want to thank you personally for inviting me here to do the welcome. And so Commissioner Patrick will be giving a few opening remarks. For those of you who are not aware, Commissioner Patrick represents District 1 and is serving in his first term. From 2022 to 2024, he was the Board of Commissioners presiding officer and is currently serving as the deputy presiding officer. He has been a champion of vulnerable communities, most notably those who are on the verge of eviction. His office funded the St. Vincent de Paul's Eviction Assistance and organization's first motel-to-hotel program in DeKalb County. He also supported the implementation of broad-based tenant protections and statewide eviction resolution program at the state. He also advocated at the federal level to reduce or eliminate 7-year credit history for residents who were evicted due to COVID-19 pandemic. So without further ado, I would like to introduce you this morning to Commissioner Robert Patrick. Thank you.
Thank you very much for that warm introduction. You know, I joke with my staff sometimes, of all the things that we end up dealing with, I really wanted to just fix the sewer system for DeKalb County. But, you know, you start working on one thing, and it leads to another, and leads to another, and so all of a sudden, we're here together in a room to talk about a bigger issue that's confronting all of our communities, and how we move forward from that. Well, good morning. I am Commissioner Robert Patrick and represent District 1 here in DeKalb County. For those of you that don't know, District 1 includes the cities of Dunwoody, Chambly, Doraville, Tucker, about 70% of Tucker from Hugh Howell 78 north to North Lake Mall, as well as Henderson Mill. Two communities that are important, very active, North Crest, as well as Embry Hills. Well, first, I'd like to thank each and every one of you for coming out to this town hall this morning. In fact, we have almost a full house with us this morning on this important topic of homelessness. In 2024, homelessness appears to touch all of us in some way, whether it's someone you know who's struggling with addiction or mental health, living on the streets, or perhaps you have daily encounters with unhoused at your local gas station or the grocery stores. Or maybe you've seen someone with a family piled into a car sleeping in a parking lot. Or you've peeped out of your backyard window and noticed tents in the nearby woods. Today, the homelessness crisis touches all of us, literally all of us. I would like to personally thank Ms. Kenyatta Turner Burrick, who you will meet later this afternoon, for putting this issue on my radar. Ms. Turner Burrick is passionate about housing and advocates for those who are in need in our community. Back in February of 2021, she alerted me and my chief of staff to what was happening in the housing and unhomeless areas within DeKalb County. This was before the issues became a daily headline. She sounded the alarm about the tactics of corporate investors, landlords, and financial hardships they were creating on families in DeKalb County. She shared how there is very little or no safety nets for people on the verge of homelessness. She also told us how rights of tenants here in Georgia are relatively limited. And she sounded the alarm on a number of people losing their homes and becoming homeless. The fallout of the pandemic, lack of affordable housing, inflation, low wages, lack of mental health resources, and outdated social policies such as evictions that remain on a credit report for 7 years have created a perfect storm in this homeless crisis that we're currently experiencing. Many of us sitting here in this room today are one of or two paychecks away from homelessness ourselves. We need to do something different here in DeKalb County because the homelessness crisis can touch all of us in our individual lives. Over the last 3 years, my office has been looking into the homeless situation in DeKalb County, and we have concluded that it will take a village, literally everyone here is part of that village, to tackle this multi-layered and complex issue. This is not something that my office, District 1, or even 10 other agencies and organizations can solve alone. Sure, we can all work individually in our silos and focus on our own mission, but we really, really want to accomplish much, much more. And I think that working together collaboratively is going to be the solution to this issue we have. Today, the homeless crisis touches all of us, And because it touches all of us in some way, it will take all of us to fix it. Whether you're a city manager, a volunteer at a church, or a retired school teacher, or corporate executive, there is a role for each one of us to play in this solution. Today's goal of the town hall is to begin the conversation on how to tackle homelessness in DeKalb County. We will hear from a broad range of stakeholders and experts in this field that will share ideas on strategies and how to shed light on challenges that we must overcome in DeKalb County. It is my hope that not only will you leave here with some key takeaways, but today's town hall will motivate you to get involved and take action. This town hall is only one step because we must keep working to move the ball forward. We will take all of these ideas and recommendations and begin the process of putting them together in order to take collective action. After today's panels have concluded, I will let you know how to get involved and the next steps during my closing remarks. I hope you all will join me, and thank you for today's conversation. Thank you for being here. Appreciate you.
Thank you, Commissioner Patrick, for those remarks. I'm just happy to be here, truly. 6 years ago, I didn't know if Human Services would be part of this type of discussion. But 6 years ago, I didn't need these glasses to read the stuff that's on it. But here we are, right? But I want to let me introduce Dr. Jeff Bailey. Dr. Bailey is CEO of Panorama Strategies. Did I pronounce that right? Okay. And Senior Advisor to CEO of Frontline and his research arm, Freedom Institute. He also works with leading foundations, think tanks, universities, and nonprofits on program design, organizational growth, and strategic planning. Prior to this, he taught at Cambridge University and was the managing director of the Center for Social Justice, a policy think tank in London focused on poverty and economic opportunity. He is a senior advisor at the University of Virginia's Advanced Studies and Culture Foundation and sits on various boards and advisory councils focused on public policy and civil society. He lives with his wife and 3 children in Washington, D.C. Please welcome Dr. Jeff Bailey.
Thank you, and good morning. It's great to be here with all of you. I actually flew in last night, not from Washington, D.C., but from Denver, where it is cold. The mountain air is still strong there, so thank you for welcoming me with some Atlanta weather here this morning, some sunshine. This is great, and it is great to be with all of you, and thank you for having me. Thank you, Commissioner Patrick, and everyone who's been involved in pulling together what is an essential conversation, and it is an essential national conversation. Many of you will know the statistics that we're dealing with. If we compare 2023 with 2022, we have tens of thousands of people who are homeless in America just in this last year compared to the year before. It's a 12% increase. That is the largest increase in a single year in homelessness, I think, since the federal government started keeping track with its point-in-time counts in 2007, the largest spike in a single year. You will see how this plays out in this context here in DeKalb County. But again, thinking about what is happening nationally, we're also seeing people move from being housed to being homeless faster, at a faster rate than ever before. From 2020 to 2022, the number of people who became homeless for the first time increased by 30%. And we are seeing far more people move directly to homelessness from a lease. So that distance has decreased significantly. We're seeing now more unhoused families with children who are homeless. We are seeing an increase after years of great success nationally and also here in the Atlanta area with veterans experiencing homelessness. We are seeing now the increase again in these last couple of years of veterans now struggling with homelessness. And some of this, of course, is compounded by all the things that was mentioned in terms of the complex reasons behind this, but we're also seeing the effects now of the waning or ending of pandemic era supports that were available. Now, as those are disappearing, we're beginning to see the consequences of this. What we do know nationally is that there is no quick fix to this. There is no silver bullet, but those who are addressing it most effectively have started by doing exactly what DeKalb County is doing right here, which is beginning to pull together the relevant people from across the spectrum: government, nonprofits, churches, policymakers, you name it, across the board, who are coming together to think about a complex problem that no one single group can fix. This is a problem that is a long, slow walk, but we are seeing examples of success around the country, and they all started like this here. So it's a great privilege to be part of the beginnings of something like this that's happening here in DeKalb County, and we've got a great group of people on different panels here to be able to speak to this. And so we are going to get started in this first panel here by understanding where we are at. I'm going to introduce a couple of folks who are going to give us an overall picture of things, and then the other panelists here in advance, so that we can move forward with things here in an efficient way in this first panel. And also, I think, Tara, you told me, I don't know where, yeah, we've got cards here just to sort of keep some semblance of control here. We've got cards down here. Feel free to grab those, or maybe you'll be handing those out, and write down your questions, and then at the end of each session, to the degree that we have time, then we'll bring forward your questions for each of the panelists in those sessions, and then we'll also have some time at the very end, I think, to pull things together and to ask some questions of those who have spoken as well. So do take advantage of these cards down here, or if Tara and others are handing those out, then you can be looking for those passing your way. To give us an overview of the state of play, I'm going to ask first that Alan Mitchell present some slides, followed by Mike Carnathan, who will be presenting as well. I've been told that you're under strict orders. You've got 10 minutes for your presentations here, so that we've got time for others as well. But let me introduce them and the others as well. Alan Mitchell is the Director of the Community Development Department for DeKalb County. In this role, he oversees the use of HUD funding to help develop viable urban communities within DeKalb County that benefit low to moderate income people in particular. You all have in your packets everyone's bios, so I'm just going to give brief orientation so you know who people are, but you've got their longer bios in your packets. Followed by Alan Mitchell. Mike Carnathan is the manager of the Research and Analytics Department at the Atlanta Regional Commission. He is also one of the founders of Neighborhood Nexus, a community intelligence system for the Atlanta region that provides data, tools, and expertise to catalyze opportunity for all. So Mike, you'll come up next and again give us some data that hopefully bring us up to speed in terms of the state of play for where things are for DeKalb County at present. Followed by that, then I'll ask you both to come up and be joined by Terry Tucker and Proteet Biswas for a panel discussion about the state of play. Terry is the president and CEO of Frontline Response International. He has spent the majority of his career leading efforts to strengthen individuals and families. Prior to Frontline, Terry was the CEO of Families First, Chief Strategy Officer for the City of Refuge, COO and General Counsel for Georgia Center for Opportunity, and Executive Director of the Sullivan Center. And then he'll also be joined by Proteet Biswas, who serves as Vice President for Homelessness and Place-Based Initiatives at the United Way of Greater Atlanta. He also provides staff leadership to the Regional Commission on Homelessness, which ensures coordination and implementation of the strategies to end homelessness in the region. So, Mr. Mitchell, I'll hand it over to you to get us started, and we look forward to this conversation in this first panel.
Good morning. Good morning. It's exciting to be here. We've got a presentation for you to give you some insight of what's going on in DeKalb County. I've had the pleasure of being able to focus on homelessness for almost 20 years. I've been with the county, and from day one up until today, it's a passion of mine and the staff. A lot of our staff members are here today to help facilitate the panels as well as contribute things. I've got a very significant key manager that we've had along with me for almost 18 years. I've been here almost 20. She's been here almost 18 years. Her name is Melvia Richards, but Melvia will come up in a couple of seconds to provide an overview of the COC, Continuum of Care, We use acronyms a lot, but the COC is the continuum of care. We've had that in place for years. We were originally part of the Tri-J, and then we broke apart to have DeKalb focus on its own homeless problems. And that was a good thing for us because we've increased substantially the NOFA allocations we've had over the years, led by Melvia and her team. And so therefore, I'd like to introduce Melvia, have her come up and take you through a slide deck, which will give you a perspective on where we think we are with regard to homelessness. It does take a village, and we look forward to getting input. Sometimes we feel like we're by ourselves, but then sometimes we feel like we have joined by others to help us. But I think today would be the catalyst of being able to move forward with the leadership of Commissioner Patrick by having a town hall to focus on this. There are many examples in DeKalb where we started like this. I'll use the Blight Task Force as an example. Years ago, we would demolish houses every other week by ourselves using many methods. But then there was a focus to bring everyone together. And today, with the CEO's help, we've abated and demolished almost 650 houses in DeKalb County. That all started with a group like this by being able to come together collectively and put a task force in place and bring focus. So we welcome all of you being able to help us focus on DeKalb as a place where homeless will be eradicated in the near term. So with those remarks, I'd like to turn the mic over to Melvia, have her come up and take you through the slide deck. And I'll stay for the panel, of course, but I want Melvia to give you a perspective in terms of where we are. Melvia?
Thank you, Alan. As our team looked at providing you information, we realized that we had much more information that we could provide to you in 10 minutes. So we have the information available in the slides, but I'll do a whirlwind presentation, and we'll speed through many of the slides that we are here. Next slide, please. The homelessness continuum of care in DeKalb County is charged with mitigating homelessness in the area. DeKalb County Community Development Department acts as the collaborative applicant for the continuum of care, and that we provide the administrative end. We assist in developing the strategy, submitting the application to HUD, monitoring agencies, and ensuring that the strategy moves forward. A continuum of care, as you see, is a local collaboration within DeKalb County organized to plan and deliver housing and services that meet the specific needs of people who are homeless, at risk of homelessness, as they move to self-sufficiency. The DeKalb goal is to prevent homelessness whenever possible, when homelessness cannot be prevented, to ensure that it is brief and non-recurring. To look at some of the information each year, DeKalb County presents next slide, please. Each year, DeKalb County, next slide. Each year, DeKalb County conducts a homelessness point-in-time count. We've conducted this count in DeKalb County since 2014, and you can see the result of the count. We've seen a decrease, a peak or a slight increase in homelessness in 2022, with again a decrease in 2023. We counted 438 people who were literally homeless at the point in time count. Next slide, please. The next slide shows you the composition of the number of homeless people on the street divided by people who were unsheltered, the sheltered, and the total. The bar in gray shows the total number of homeless. Next slide, please. To give an annualized projection, we take the number. Remember that the point-in-time count shows you a picture at one point in time. To look at that number annualized, we would say that for 2023, there were 1,226 homeless people in DeKalb County. And again, that includes those people who are sheltered and as well as the people who are unsheltered. To look at the number of people who are on the street in 2023, we see that the number shown at the point in time count, annualized, that number would total 636 people that you would expect to see on the street in DeKalb County in the year. At the time of the point-in-time count, we also conduct surveys to understand some of the issues or some of the reasons that people are homeless, and also to understand some of the efforts that we might need to engage or enforce in order to mitigate the homelessness. We found during the survey that 66% of the people, according to their report, reported that they had some form of mental health problem. And we saw that the dominant disability was mental health among the people who were homeless at the time. To look at the causes of homelessness, according to the reports of the people who were interviewed, their chief causes, according to the interviewees, were economic, family situations, alcohol, drug, and housing problems. When we looked at age, we saw that there were 25% of the people were under age 18, to indicate that we have a problem with homelessness among children. We found that 24% of the people were aged 55 to 64. We also found that 167 of the people counted belonged to families. There were family members in 167, and 271 were single people. In veterans, we looked at veterans because we achieved functional zero several years ago. And functional zero means that basically any veteran who was willing to be housed could be housed in 90 days. We were awarded functional zero by HUD in around about 6 years ago. So every year we try and look at how many veterans we're seeing on the street. Again, you can see that in 2023 we had an increase. We saw 23 veterans on the street at the time of the point-in-time count. Then to look at, and again, I apologize, I'm speeding through the information. I'm sure our team member who conducted, who was the manager for the point-in-time count is here, Dr. Josie Batchelor, and she can answer any additional questions about the point-in-time count later. To look at how we house people, we thought we'd present you some information on the housing inventory. At the time of the 2023 point-in-time count, we had 189 eligible emergency shelter beds. Those beds were 95% occupied, and we have to keep in mind that some of those beds are family beds, so 100% occupancy could not be expected because some of the space had to be reserved for family members, and so that if, for example, if you had a room for a family with 5 children, and other rooms, and they only had 4 children, that would be one bed that might be vacant, but another family coming in would say 6 children who had a child maybe 17. It was not possible always to share rooms for those families, is my point. Transitional housing, we had 32 beds available. They were 97% occupied, and permanent supportive housing, housing choice voucher, rapid rehousing, we had 1,242 beds available, and it was 97% occupied. Next, how do we get people from the street, from homelessness, into those beds? In DeKalb County, we used a coordinated access system. We call it coordinated entry. It's HUD system as well. And that system provides for access, for assessment, for prioritization, match, and referral. In other words, people call in. We actually started looking at the system long before HUD mandated we have a coordinated entry system. We put together a panel of agencies, citizens. We hired a consultant. We had meetings for approximately 9 months to say, what is the best way for people to access services in DeKalb County? That committee came up with a plan. About the time that the plan was finalized, we received additional funding, and we tried a system with that funding. We tried a no wrong door approach. We found that did not, while we thought it would be a great system, we found that it did not work well. We found DeKalb County is a very, very large county. People had trouble getting to, even though we said no wrong door, they had people getting to those locations, and transportation was an issue. So we started using some of the tools that we had readily available, and we used a call center. And we found that most of the people who were homeless had access to cell phones, and we could also use our outreach specialists. We have people who who visit the streets every day to engage people who are unsheltered, to try and build relationships and move them into services and housing, so that we could use 2 ways to have people access our system, through their cell phones or through a telephone system and through outreach. They go into the system, they are assessed to determine whether they are eligible. We have a self-scoring tool that is used for prioritization for certain services, and then they are matched and they are referred out. Next slide, please. To access those services, we have one telephone number, 404-687-3500. At the time, it's open from 9 until 2 because we encountered the same problems that many of you may have encountered. During the pandemic, people moved to other jobs. We had a problem increasing our staff or filling those positions, and we are now in the process of increasing the people in the system so that we can then go back to being open from 7 in the morning until 6 in the afternoon. I'll skip some of the next slides in the interest of time, but we can go back and give you information about them if you like. If we can slip over to slide 22. To give you some information, next slide. The sources of funding for my HUD COC grant, about $7.6 million, about $0.4 million from Emergency Solutions Grant. We incorporated funds from ESG-CV, CDBG-CV, some of our COVID-related funding to try and house people as quickly as possible. But that slide gives you an indication of some of the funding that's available. From the HUD COC grant, part of the problem, $7.8 million, may look like it's quite a bit of money. The issue is that 64% of that funding goes toward permanent supportive housing, and those beds do not turn over rapidly. So that means that there are people who are housed. They may be permanently housed in permanent supportive housing for years, but that is not creating new beds. From a historical perspective, we've engaged in a number of projects to gain experience and knowledge, information on how we can best serve people. Those things we were one of the first areas to look at youth aged out of foster care and put together a system to provide housing to youth who might be homeless except for our assistance. And we engaged youth, provided services, provided psychiatrists, full-time case management to help them move to stability. Households in hotels. We were the first program to actually experiment with households who were living in hotels in order to provide case management services to move them to stability. During COVID, we actually went onto the street, picked up people on the street, took their belongings, took them and had them treated for bed bugs, other pests, moved them into non-congregate shelter, provided new food, new clothing for them, case management to move them to housing. Our goal is, and to move quickly and end, we are also taking home ARP funds at this point, $7.8 million. We are using the information that we've gained over the years, the knowledge, to put together a system to not just help people stay housed or move into housing, but also to put together all of the services that they would need to ensure stability. Our goal in that program is to assist people to move into housing, to prevent homelessness, but to ensure that once the assistance ends, that they remain stably housed.
Thank you so much. As I think we'll experience this morning, this is such a complex issue, and there's a huge amount of data and information. I think hopefully the slides and the information, some of which you didn't get to cover this morning, will be available to people in various ways. And so, thank you as we try to continue moving through and hearing from different people. Michael, please join us and give us an additional perspective from a data perspective.
Thank you. Just like the previous speaker, I'm in the same boat. I have way too many slides for the time allotted, so I'm going to fly through these, and yes, these slides will be available to you. Now, you've heard the numbers about homelessness. What I'm going to do is I'm going to sort of go a little upstream a little bit and talk about housing instability. That's going to be, families that are, one financial shock, maybe two financial shocks away from becoming homeless. And so that's, kind of because the best way to tackle homelessness is make sure that it doesn't happen to begin with. So next slide, please. This is ARC. You can see our vision, our mission, our values, our goals. Obviously, homelessness is going to be embedded throughout all of our goals. Next slide, please. And so I really wanted to start here, because I just wanted to get you, where we're at today. And the simple fact of the matter is wages have not come anywhere close to the appreciation of rents, and it's definitely the appreciation in home prices. And so every single day that I make this chart, that gap grows a little bit. Next slide, please. Now, what I'm going to do now is sort of level set you on what we mean by affordability and I'm talking about us eggheads, up at the federal egghead level down to the local egghead level, how we are defining affordability. Next slide, please. Busy slide here, but every single year HUD defines the area median income for places like Atlanta. And you'll see in bold there, for a 4-person household at 100% AMI, that is $102,000. Now, the way that we define affordability is if you're paying more than 30% of that income on housing, you are considered to be cost burden. Now, on the upside, on the upper part of that slide, you'll see kind of the equivalence of rents that meet that threshold. And so these are maximums. So you'll see a 3-bedroom house, a 3-bedroom apartment at 100% AMI is about $2,655. If any more than that, you would be considered cost burden. And so that's a pretty high rent level. Let's just go ahead and admit that. And so that's just sort of the overview of what we're thinking about in terms of affordability. And I'm going to come back to this slide later on. Next slide, please. And I always like to put this in the terms of people. So look at some of these salaries and look at some of the occupations here and see where they fall on that AMI perspective. And I'm really presenting this sort of as a continuum. Not, don't get confused with continuum of care, but sort of a continuum, like a sort of a flow. Because at each level, like from homelessness to the extremely low to very low to low, different housing policies are going to be needed for different parts of the flow. Okay, and so just keep in mind that there's a continuum of policy that's appropriate for each levels. Next slide, please. And this just again level setting This is from the MIT Living Wage Calculator, and this just gives you an idea. And this is just to get by. You know, this isn't a thriving thing. This is just what families need to get by based on your family situation. And what's always shocking to me is this number here. So one adult, one child, and you may not be able to read that because it's real tiny, but it's $85,000 is the income needed. And then that's to get by. And look, we can quibble with that number. It may not be 85. This is just sort of them doing a data exercise. But again, the scale of that should be shocking to you. It's just like, you know, there are a lot of families that are struggling. Next slide, please. All right, so let's talk about renter instability. There are homeowners that are in unstable situations, but we're going to focus on the renters because we're really talking about that upstream, kind of that next step upstream from homelessness. Next slide, please. And this is the situation in the core 5 counties, and you'll see DeKalb County sort of highlighted there in white. There are 65,000 households, renter households, that are considered to be cost burdened. That's more than half of all renter households are considered to be cost burdened in DeKalb County. Keep moving in this table, you'll see that there's 33,000 households that are considered to be severely cost burdened. And what that means is they're paying half of their income on housing, so 50%. These are the households that are in severe danger. Right? I mean, these are the households that are one financial shock, one big hospital bill, one big car repair bill away from becoming very close to be or becoming homeless. Next slide, please. And you'll see essentially what this slide is looking at is extremely low income renters, and that's that 30% AMI in DeKalb County and in all the other core 5 counties. Essentially, every extremely low renter household is severely cost burdened. Every one, pretty much. And so that's the scale of the problem that we're dealing with. Next slide, please. And here you'll see, and again, this comes from the National Low Income Housing Coalition. And what they do is they look at, okay, how many renter households are at that 30% AMI level? And here's that's going to be the chart to your left. And you'll see it's about 29,000 in DeKalb County. And then the other chart looks at just, just the gaps. How many houses do we really need? And you'll see that, in DeKalb County, it's about 23,000 gap. And so in other words, we have practically no inventory at all to house extremely low income. Yeah, next slide, please. And so this is a map of renters paying more than 50% of their income. So that's that severely cost burden. And what you're looking at is you're looking at the red areas. And what you'll see in DeKalb County, it's not a North DeKalb thing. It's not a South DeKalb thing. There's pockets everywhere where there are severely cost burdened renters. These are these folks that are just on the brink of homelessness. Next slide, please. So we're going to come back to this, and you'll see that 30% AMI, and you'll see that at the end, that's 796. So we're going to peg that. Next slide, please. Here are all the rental units in DeKalb County that are renting for $800 or less. You'll look at the red areas. Well, first of all, you look at the blue. That's 0. All right. Next slide. Here are the areas where there's 35% of units. There's just nothing there. Next slide, please. And then we're also going to take that out to, maybe let's look at the 60% AMI level. Then the story gets a little bit better here. Next slide. You'll see that there's lots of, plenty of inventory on the south side of DeKalb, almost none on the north side. Next slide. And we can do the same exercise to where 35% of the units are renting for $1,500 or less. You'll see that there is inventory out there, but it's mostly concentrated in southern DeKalb. Next slide, please. And here's the issue, is that at those two price points that I just went through, the $800 and the $1,500, over the last 5 years, DeKalb County's lost about 42,000 of those units. And every year I make this chart, it gets bigger. So we're falling further behind in just terms of trying to grapple with housing instability. It is not, because it's, and that's a good point. Inflation would, the inflation levels that we've had in the last couple of years will make this a little bit worse. Next slide, please. And then if you look at evictions, and so, evictions are really back to baseline levels. For a while there during the pandemic, we kept thinking about, okay, there's going to be a tsunami of evictions coming, there's a tsunami of evictions coming. Thanks to the moratoria, that didn't really happen. But now that we're in that post-pandemic period, you'll see that evictions are really much back to where they were before the pandemic. And here's the thing, if you're getting evicted in this housing market today, you're considerably more likely to stay unhoused than become rehoused. And so, yes, they're at the same levels they were 2019, but eviction has a lot more consequences today than it did 4 or 5 years ago. Last slide. And this is going back to that point in time count, and this is at state level. And what I wanted to emphasize here is, and again, this is for the state, so it looks a little bit different than the DeKalb data. But look at some of the reasons for homelessness at the state level. You'll see domestic violence, you'll see chronic homelessness, mental illness, substance use disorder. All of that is stuff that really talks to systemic challenges. And so when I talked at the beginning about a continuum of housing policies, some housing, at that very low income level, well, that just requires a lot of public subsidy. And then you get into workforce housing, and that's going to require, kind of gap financing. Yes, some public subsidies, but yes, maybe some private, maybe some down payment assistance. When you're talking about the homelessness, you're talking about a whole nother basket of policies that you have to think about. It really goes beyond what's in that housing policy basket, and it really starts talking about systemic issues, thinking about mental illness, thinking about health, thinking about substance abuse. And so that's sort of the challenge ahead of us, because this transcends your typical housing policy, and you really have to think more holistically about the whole person when dealing with this. And that's all I have, so thank you.
Mike, go ahead and stay up here if you want to. Go ahead and stay up here, grab a seat. Alan, if you want to come up as well. And then can I ask Terry and Proteep to come up as well and grab a seat. We'll see if we have time for questions here or not, but if we do, maybe gather up some cards, and if we don't have time, then we will do that towards the end. But I wonder, Terry, if we can start with you, and then Proteep, if you could speak to this as well, both from the frontline perspective and then from the United Way perspective. We've heard some really important data at a more kind of 10 to 20,000 foot level. Can you talk to us about what you are seeing on the ground in terms of the face of homelessness that we're facing now from the perspectives of your work and your organizations?
For sure, and thank you, Jeff, and it's been a pleasure to work with him for over 12 years on the ground, and it was actually a really nice kind of an introduction to see all the work that these guys are doing at these levels to kind of understand what's happening. But as they were talking, it made me realize how long I've been on the ground doing this work, starting with Sister Marie Sullivan, the Sullivan Center, doing the prevention work way back when, and then all the way through City of Refuge and Families First and VEO. And what we're seeing is kind of like a changing face of the unhoused, where back then, people saw homelessness as people that was, a lot of the people that were on the side of the street that were asking for money. They were seeing people that were, succumbing to the increasing in rent, and those sort of things. But what we've seen, even over the last several years, is that the increase in the diversity of who's become unhoused. And so this past season, just to give a comparison, as Damon said in the beginning, last season when we opened the warming center at Frontline Response, we had 20 people a night, 20 people. This last season at Frontline, we had close to 130 to 150 people per night. We saw over 7,000 intakes just with our center. And if you look at what Damon had at the rec center and what our partners at New Life had, we had so many people that we were almost maxed out every night. And the surprising thing about it, it wasn't just people that were finding us that were in encampments or on the street. We had families, husband, wife, kids coming in to see us. We had teenagers, 18, 19-year-olds that were homeless. We had a lot of working homeless. We had to be sure they were up at 5:30 so they can get on the bus to get back to their jobs. And we had a significant number of seniors that were unhoused. And so for us, we started to think about how can we continue to be on that front line in that gap, because what we're trying to do is what happens when a lot of the work that these guys are doing fails people and they do end up homeless. A lot of times experiencing something that traumatic can not only impact you from a financial perspective, but it also takes a toll on you psychologically, and you don't know where to turn. And so one of the reasons why I joined the organization is that Frontline is really there to be sure that we have the transportation to go where people are. Go to the encampments. If you don't have a phone, we'll get you to a place where Alan and his team can take over and get you through that work and be with you through that whole thing. But if we don't have those initial bridge type of offerings, a lot of times people don't get to the other services. And as I wrap up, one of the things that we also experimented with that we saw was extremely effective is that in addition to opening the warming center, which was really helpful for people to protect them from the weather, what we saw is that when we extended the warming center and had it open 24 hours, people stayed to get services. We ended up having people making medical appointments, and we took them to the medical appointments. We had people getting tested for various things, whether it's tuberculosis or COVID. We had people able to take showers, get clothing. We had people actually sign up and to go to substance abuse programs because we had counseling people on the site. So for us, as we continue the conversation, we're looking at ways that we can all work together to catch people when they do slip through, to be sure they don't stay. But then we also have to continue these types of partnerships with people that, like Proteep has been doing this for a while, that can help provide funding and leadership, and people that have the various services, and we all have to do it together. So we had a partnership with people to do what we did over the holiday, and we look forward to continuing to do that.
Great, thank you, Terry. Proteep.
You've heard enough data, right? So this is an amazing presentation now there. Thank you. And the message for everyone here. I'll use yours. I always like using other folks' stuff. That's collaboration to the maximum, right? You've heard the data. This was an amazing presentation. Again, for those of you new to the chat or those of you who are coming back, it's been happening in DeKalb County for a long time. The good stuff. The problem's also been there for a long time. But as a community, remember, Melvia mentioned DeKalb has gone to functional zero with veterans. When we come together, work together, right? It's not the first time that you're coming together, but the problem keeps coming up. There's an increase in homelessness that we don't control. Mike's slides on housing, that itself, 23,000 units short. So it's what are we going to do now? In terms of collaboration, even in the funding place, there was this injection, unfortunately, because of COVID, but because of that, we got a lot of resources, the ARP funds. Those federal funds are sort of drying up. Right? And there's been also a change in the philanthropic side. So the environment changes, we need to come together. No one entity does it alone. It's not just federal funds, so it's a partnership between public and private partnerships. So really grateful, Commissioner, for bringing this conversation. We need to not only come together in terms of funding, in terms of action, in terms of the players involved, in terms of getting regular citizens. So I'm really thrilled that you have, like, I'd not heard of this Shamli group. I'm looking forward to hearing about it, right? This group of citizens coming together. That's what makes us strong. So I think we hope this conversation continues. We want to be part of it. There's always a crisis. There's always too many folk demanding resources. We get it. We can complain about it all day, but it's the solutions that come. So I see a lot of familiar faces, SVDPs here, helping families in motels. Again, it doesn't have to be the only one. We can come together and work on it. There's a home for everyone in DeKalb that's pulled together and got a house, right? Again, folk in DeKalb have been doing this, so thank you for getting energized again. We need to be intentional, and it's not just DeKalb. We need to be able to pull resources from everywhere, but it starts in your county.
Great, thank you very much. So we've got time for maybe like 2 very quick questions. Do we have anything?
If anybody has any other questions, I'll walk around and get it from you.
Do we have any data about how many of our DeKalb homeless are back and forth with Atlanta services?
DeKalb is part of DeKalb is part of the Atlanta continuum, right? And it's a flexible mark, so it's not really, but it's not like people from DeKalb go to Atlanta, people from Atlanta also come to DeKalb. So I think that's a good question, but the data really doesn't tell us anything special.
Right.
We have seen it at the warming center, and it's hard to track because people don't have existing addresses, so you can see kind of where they're coming from. But we noticed that there was probably, of the 126 people that, or 130 people that we have, we would probably have upwards of 26 or 27 people that we know that came from other areas that traveled to DeKalb. So that's kind of like what we're seeing. We're going to look at putting more things in place to kind of be more specific on that.
Alan, can you speak to that?
I'll take this one. Yeah. I think I heard the question, but I'm not clear on it, but it has a reference to, could you restate the question?
Just the data in regards to the back and forth for our DeKalb homeless back and forth with Atlanta services.
Okay. So from our perspective, what we've seen is that there is a proliferation of homeless individuals from various jurisdictions. So because of the access to water and other facilities, you can easily get to the cab, and the cab is viewed as being more friendlier. So what we tend to have is a lot of individuals from other jurisdictions are being placed in the cab. We have the largest amount of hotels in the state of Georgia. And as you indicated, per ARC data, our rents tend to be a little bit lower. So why not come to the cab? So what you find is people being placed in lower rental units because they don't exist in other areas. Point 1. Point 2, if you get into the hotel extended stay algorithm, hotels here are less expensive. Probably a lot of you can go buy a hotel for the prices in the cab, whereas in other counties you can't do that.
Yeah.
So as a result of that, we have agencies putting people in the cab because economically it makes sense. So as a result of that, it has, so we welcome them to be positive, but it does have an adverse effect on the sustainability in communities by having economics positioned in such a way so that other jurisdictions can put people here.
Yeah.
So we do see a lot of transition from other jurisdictions to DeKalb County for those 2 reasons.
So let me ask one more, because we need to take a break here. So if you can, maybe we can get a couple of 30-second answers to this. What are we seeing on the ground in terms of aftercare and after folks are housed in terms of needs and opportunities there?
Not enough.
Does it reduce recidivism when that is happening?
Does it reduce recidivism is the question? Yeah.
I can. And Jeff and I have done a lot of the research on this, and this is one of the reasons why the approach. There's a slide, that last slide, if you guys have it, you can throw it up there. When you come together collectively and you do the aftercare, Brookings Institute did a study, and if you hit all of those points and keep those people in the system, they usually have about a 7% chance of recidivating back into homelessness. For every one of the points that you don't hit, and those impact measures, and some of them are like making sure that they are making 250% of the federal poverty level, making sure that they're reunited with their family, making sure that they are going to their appointments. if you don't hit those things, every time you miss one of those things, the probability of it going, recidivating goes up, to the point to where there's almost a 95% chance if you don't get that aftercare, you're gonna be back homeless again. And what ends up happening is that you waste all of that. I don't want to say waste. It wasn't the best use of all of those funds when everybody came together, because you didn't do it in a collective fashion and you didn't focus on the actual points that you need to be sure that someone is prepared for the new homes. Unfortunately, even over this last month, we've placed probably 30 to 40 people in permanent housing, and they didn't get as much wraparound services that they need, and they weren't able to keep them. We're seeing that just happen in a matter of months. So the better we can keep them with all the other agencies and the work like what the Continuum is doing, they can probably stay unhoused a lot longer.
I'm going to stop us there. We will have opportunity for more time for Q&A at the end with a number of our panelists. And so in the interest of time, I'm going to stop us there. But I know there's more questions here and more questions that are in the audience. Can we thank our panelists for this? So we are running 5 minutes behind. We've got a 10-minute break. We're going to start here right at 9:45. And so if you make your way efficiently to get a cup of coffee or use the restroom, and we will be starting the next session promptly in 10 minutes. So do you want to tell people to, we'll start in 3 minutes. I'm going to actually ask all the panelists to come. Actually, I was going to do that right now, have them take a seat. So if you're on, what's your name? Oh, Tammy, good to meet you. Yeah, so if you want to grab your stuff, grab a seat, I'm going to ask the panelists to come on up. Can we have the panelists who are going to be part of this session come and take your seat up here, please?
Ladies and gentlemen, our next panel will begin in roughly 1 minute, so we ask that you please take your seats. Our next panel will begin in roughly 1 minute. Thank you.
You can announce that they already have some written questions that they can walk up here and drop them in the box. Okay. Also walk down with some,
And you know what? If you grab a microphone, so you see it.
okay.
If somebody just has something we want to do that as well.
Okay.
I'm going to start with the forms.
Okay.
We have that as a backup option.
Okay. Okay. So I'll have to try to grab one of theirs. Okay. That's fine.
Which one?
So do they have
They've got microphones up there, yeah.
extra? Okay. I didn't know that.
So we're missing one person, I think, aren't we? We're missing, we're missing Timothy Hardy.
I have no idea what it is.
Are you joining us up there?
I think so.
Okay. All right, let's grab our seats, everyone, and we'll get started.
So I don't need that if I have this, right? Okay. I figured somebody doesn't need to. Right.
All right, can we grab our seats, everyone? We'll get started. Go ahead and find your seat. right, everybody, we need you to take your seats. We're going to get started. I know it's hard.
Testing, mic check.
If we can wrap up our conversations and grab our seats for this second session. We've got a lot of folks here on the panel who have been working with these issues on the ground here in DeKalb, and we have asked them to address some of the best practices that they're seeing on the ground in terms of closing the gaps in services. And so we want their particular insights from where they're placed. So what I'm going to do is just, is it just me or is there? Is there a way we can eliminate the issues on the ground here in the sound that's coming through those speakers? We'll ask them to address these issues on the ground here in their and on the ground in terms of closing the gaps. Some of the best practices that they're seeing on their particular ground in terms of closing the gaps in service. What I'm going to do is just, and so we want their particular insights from where they're placed. So what I'm going to do is just eliminate that. Just meters there. We've got a lot of folks here on the speakers who have been working. We can eliminate these issues on the ground here in the those speakers. We have asked them to address some of the best practices that they're seeing on the ground in terms of closing the gaps in services. And so we want their particular insights from where they're placed. So what I'm going to do is just Here, stop. It's back on. It's back on. Here, stop. Here, stop. It's still on. Off. It's back on. It's still there. Here, stop. It's back on. Here, stop. 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 All righty. Oh, it started back up. Is this, can y'all still hear this coming from this speaker? Oh, it started back up. Oh, it started back up. Is this, can y'all still hear this coming from this speaker? Is this, can y'all still hear this coming from this speaker? Oh, it started back up.
I'll stand right here the whole time.
All right. Nobody move. All right, we'll keep our fingers crossed and hope this blessed silence continues. All right. We've got a great panel. Oh. Testing 1, 2, 3. Testing 1, 2, 3.
Stand by, 5, 4, 3, 2.
All right, welcome back for our second session. We've got a great lineup of panelists to be able to speak to where we need to go, best practices, and closing the gaps in services. And so these folks have been working on the ground in all kinds of ways with those kinds of questions. So I'm going to introduce them in a moment, and then I'm going to ask each of them to speak for just 3 minutes or 4 minutes or so that, again, we've got time for conversations and Q&A about what you're seeing from where you're situated with practices on the ground in terms of best practices and closing the gap. So I'm not going to do this in exactly the order in which we're seated. Maybe you can wave as I'm saying briefly a brief intro for you. Tiana Mazel serves as the Warming Center Director for Frontline Response, where she serves fellow citizens in her native DeKalb County. She has also held leadership positions within the nonprofit sector, state of Georgia, and local community service providers. Heidi Everly has been the program manager for St. Vincent de Paul's Motel to Home program since its inception in 2019, starting with an initial 12 families, helping them move into housing and providing wraparound services. The program has continued to grow and today has helped over 250 families move into stable housing. Dr. Tammy Hughes is the executive director of A Home for Everyone in DeKalb, an organization providing financial assistance, transitional housing, and other supportive services for those experiencing homelessness in DeKalb. Christina Porter is the founder of Chamblee Coalition on Homelessness, a team of citizens, nonprofits, government agencies, and faith communities that work towards solutions for the unhoused in DeKalb County. Timothy Hardy is the Deputy Director for the DeKalb Code Compliance Administration. He has also served in various positions related to code enforcement with the City of Smyrna, Sandy Springs, and Fulton County. And then Tommy Phillips is the Community Development Coordinator with DeKalb County Community Development Department. And prior to his role in that position, he served as the Engagement Manager for all Pathways Homeless Management Information System community implementations, where he coordinated communications and other matters related to the Continuum of Care projects. So we've got a great group of folks here with us to think aloud about these matters. Can we just start right here, and then we'll work our way down? And again, just take 3 or 4 minutes to give us your perspective from where you're situated, and then we can have a conversation.
Absolutely. So some of the successes that we've seen at Frontline Response is that when
Is your mic on? Okay, you can hear.
some of the successes we've seen at Frontline Response, as piggybacking off what Terry said earlier, is when we spent more time with those. Absolutely. That's a little bit better. All right. So some of the successes that we've seen with speaking with those individuals is spending the time with those individuals and spending one-on-one time with them so they can have individualized case plans with them, addressing their trauma-informed care and their individualized needs, but also collaborating with other service providers where we were able to seek placements and see long-term jeopardy with those individuals and spending that time with them. Because as you know, this is a complex issue, so just having that warming center aspect with them, we didn't spend that much time with them, but when we did those 2 pilots and we were able to spend more time with those individuals, we were really able to dig in to those individual needs. So having forums like this and just continuing our collaborative efforts, I know we've done it before in DeKalb, where we have reinvented what we needed to do and came together. So it's that time again that we can all collaborate together and continue efforts like this together, because it's going to take everybody, all municipalities, and not just those individually, but we have to do it all together. But it can be done.
I'm not a speed talker like Diana, so I will try to speak up for those in the back, though. I wanted to say, first of all, I'm a social worker, so I'm a solver. And when I encounter our citizens who are unhoused, and the term that they're our neighbors, they're also our clients because they're unhoused for a reason. Part of it is because there is a lack of enough housing, and I appreciate Mike's drawing our attention to how vast that problem is. The other ancillary issues that they're struggling with make it necessary for our wraparound services to happen, which is why we have to be collaborative in everything that we do. I think that's going to be the underlying theme to what we all talk about, is how it takes all of us. We are taking on some of the toughest challenges to help some of the most desperate individuals in our communities, and so none of us can do it alone. We have to work together to make sure that best practices are uniform across our collaboration, and that none of us can be all things to all people. So we'll try to do what we do well and then pass our neighbors off to the next organization so that they can do what they do well. At Home for Everyone in DeKalb, what we do well, a couple of things. As was mentioned, we do have a transitional home for men in a residential neighborhood in DeKalb County, which is experiencing no NIMBYism as a result of that, because we provide some wraparound services. We didn't just plop them there in that house and leave them. We provide case management for them and make sure that they are following the case plan, because it isn't permanent supportive housing. It is a transitional house, and so our goal is to help them transition from us into a permanent housing solution with those wraparound services so that we aren't seeing that recidivism that Terry talked about. We also provide rapid housing assistance, not rapid rehousing, but rapid housing, because we're able to forego some of the bureaucracy that is necessary in some of the other organizations. But if you are facing eviction, you don't have time to jump through 12 hurdles. Your landlord wants their money now, or they'll see you at the courthouse, right? And so we're trying to help to avoid some of those courthouse trips by offering that financial assistance. One of the challenges, I have to say, is we talk a lot about eviction prevention and assisting families once they're in eviction. If you're low income, you really can't afford to get an eviction. One, you're low income, meaning you likely have credit challenges. And once you're in eviction status, that exacerbates your income challenge and your credit challenge, which means if your eviction is enforced, or even if you forego it, you'll have that much more of a difficult time getting rehoused, right? And so we want to work on, I heard one of the panelists talk about going further upstream. So one of the ways that we can mitigate homelessness and it growing is that we catch them before they become homeless, right? So the panelists who talk about housing stability, that's our goal, is to make sure that they never enter into the ecosystem of homelessness, right? So we can't do all of that. So it takes all of us up here and the panelists who came before us. So we do transitional housing, we work on rapid rehousing, and we also have a new initiative that I'm proud to say we're partnering with Commissioner Patrick. Melvia talked about some of the challenges of getting our unhoused neighbors to the services that they need. And so one of the proposals that we put forth and that Commissioner Patrick's office is funding is an initiative called DASH, and that is DeKalb advocacy supporting our homeless neighbors, right? So in short, DASH is going to help get them from where you see them to where there are services connected, right? I believe in inverting the burden. Don't give me a card with an appointment. Take me there or help me get there. Where are the services? What time are they open? What do they do there? And so with our initiative, we will be working to get those in need to the resources instead of trying to get the weight on the person who's already in need and already in a desperate situation. So those are some of the things that we do. I look forward to partnering with more of you in this room and all of you on this panel. Thank you.
Thank you, Tammy. My name is Tommy Phillips, and I work with the community development and multiple programs. One of the ones I want to talk a little bit about to you today is about the street outreach team that we're staffing in community development in DeKalb County. We have a lot of our teammates here present today that help us with the street outreach. We have coordinating entry. We have Dr. Josie Batchelor in the room that works with our agencies and homeless individuals. I think you have issues in a lot of the communities across DeKalb County, so what we've offered is the ability for you to call in, let us know when you see on the unsheltered, to reach out to us so we can send our team out to help them get connected to services. I think one of the challenges that we've had is trying to make sure that people know how to reach us when they don't have cell phones or they don't have communications. So our street outreach team's out there helping them doing street intakes to make sure they can connect to services and make sure we can get them housed again and get them off the street. One of the challenges that we have is that DeKalb is so big. We have over 270 square miles in DeKalb County that we're responsible for. So you start seeing now a lot of homeless people in the wooded areas. Matter of fact, we have a cleanup going on right now, right outside this facility here on 85 that's going to take place on Monday. So with the help of code enforcement, Mr. Hardy, we're helping to try to connect to some of the problems that we have across DeKalb County and clean up some of the facilities that you may not see it. Sometimes homeless people are invisible. So you don't really know that across a lot of the interchanges right in DeKalb County, we have homeless people in the underpasses at the bridges. And we've had that situation here right at 85 and Shanley Tucker. We cleaned that situation up, but we relocated the individuals there. We have another one on North Crest that we're getting ready to do on Monday to relocate those individuals and get them connected to housing. And that is the responsibility of our outreach team to be able to do that, connect them to services and get them in the shelter. In a lot of cases, sometimes they're not ready to go in the shelter. I think one of the things you need to understand is their choice, it's a personal choice. And we have a struggle with our policing unit, so we work directly with the DeKalb County Policing Unit when we have situations where we have people on the street and they haven't made up their minds yet that they want to go in housing. So it's always a challenge, and our outreach team has to go out with them and work with them to get their trust to make sure that they can make up their mind as to when they want to go into shelter and seek housing. And so we're looking to do more of that and have more people out in the street connecting with services and connecting with the unhoused and get them connected to services in multiple ways. Through the help of the Department of Community Affairs, we bought 2 vans. So you probably see our little white vans running around DeKalb County to seek and find unsheltered individuals across the county and connect them with services. We have limited shelter space. One of the challenges that we have is you look at the numbers in terms of people that we're seeking on the street, you have to match that with shelter beds or housing, and there's a mismatch. So thanks to Commissioner Patrick having this session, he's going to help us fix that problem. And that way we can look at increasing the amount of bed space we have to seek more available housing for the unsheltered so we can really help you see the problem, because you pass by it every day. Just need to understand what's going on in the heads of some of these individuals. It's not magic. Sometimes it takes a while for that light to go on, for them to understand it's time to go in. So we're going to be working directly with our friends at code enforcement. We're going to be working with policing units to seek more help to get people off the street. Looking forward to working with you. If you have issues, please call Coordinate Entry and let us know when you see unsheltered individuals, and we'll seek those individuals out and get them connected to services. Thank you.
Thank you, Commissioner Patrick, for organizing this phenomenal opportunity. We ready? I'm Christina Porter. I'm a 33-year resident of Chamblee, which is in North DeKalb. And as a concerned citizen, I'm honored to share my thoughts and experiences with the homeless community over the last 4 years. My journey is a little bit different because I am a citizen, not a nonprofit or a government employee or a county employee. My journey began in March of 2020, which feels like a lifetime ago, but was only 4 years ago, when I heard that homeless shelters in downtown Atlanta, due to the shutdown, the lockdown, had no food. And I mobilized people in our community to provide an average of 1,800 handmade, homemade sack lunches that were delivered to 9 shelters in downtown Atlanta every single Saturday for 3 years. This is about community and working together. My volunteer drivers every Saturday kept seeing more and more homeless people on the streets, and they didn't know why, and they didn't know how to fix it. So I saw an opportunity and led a homelessness symposium in 2021. And I will tell you that there's such a difference between what people think homelessness looks like and what homelessness does look like. And my audience members were shocked to find out that DeKalb has no shelter, that many services are limited by barriers, the family makeup, whether you have a pet or you have medical issues or mental, whatever it is, there are a lot of barriers that prevent people from seeking services or getting services. And above all, it was shocking to many of the audience members how debilitating it is to try to navigate the system when you don't have an ID card, when you don't have a cell phone, when you don't have an address. That is a starting point and a huge barrier. So I used all my Sack Lunch Brigade connections with the shelters downtown and I saw a need and began building the Chamblee Coalition on Homelessness. The objectives are to break down the silos within and between service providers, to eliminate duplicate efforts and streamline deliverables, and to work together so we can work smarter and speed up success. The coalition umbrella involves food pantries. I'm part of the Chamblee Nonprofit Partnership Program, the Chamblee Police Department Task Force on Homelessness. I'm a board member of the Community Assistance Center in Dunwoody and Sandy Springs, which their sole purpose is to prevent homelessness. The DeKalb County at large has the House the Unhoused DeKalb Alliance, which has done phenomenal work. And then nonprofits in the North DeKalb area. I saw a need in 2022, winter of 2022. I figured out how to operate a warming center for women in Brookhaven, had the desire and the intent to do another warming center for women during the cold winter months in Doraville and Brookhaven. We could not get permitted. Not looking at anybody in particular. Sorry, I just had to throw that in there. We could not get permitted to operate, so I shifted gears, and I was at the North DeKalb Senior Center, which is the collection point for homeless to be transported to frontline response. I just want to shout out right now, thank you DeKalb County for having a county-wide solution on cold nights. Thank you to Frontline. Thank you to Frontline Response for stepping up in a huge way. Thank you for the City of Brookhaven for your support, and a big shout out to the Chamblee Coalition on Homelessness volunteers who were out there every cold night. We had 61 cold nights. We were out there every night standing with our homeless, listening to them, encouraging them, giving them hats and coats and gloves and socks and shoes and MARTA cards and snacks and hot chocolate. This is what a community effort could look like. And I just want to say in closing, if I can do this as a private citizen, without a big account, without a job description, without an MSW degree, imagine what we can do with the hearts and minds in this room. Imagine what we could do.
So I'm with St. Vincent de Paul. I think a lot of you are familiar with us. And first of all, I want to thank Commissioner Patrick because you were one of our very early funders. Thank you so much for supporting Motel to Home. It's an incredible need out there. We work with a different community. So our families are working families, hardworking families who have income to afford rent, but they've lost their housing at some point and they've ended up in hotels. Hotels have become family shelters. Very expensive family shelters. Families are paying between $400 and $500 a week to live in these. So that prevents them from saving money. They can't get that first month's rent deposit to move out. That's where our program was founded. I've been a volunteer caseworker with St. Vincent de Paul for 25 plus years. And we kept going to the same hotels, seeing these working families stuck. We could help them with a week in the hotel, but that was kind of all we were doing. So a co-caseworker of mine, Denise Fisher, who is now our board chairman for St. Vincent de Paul, Georgia, decided we have to do something. These families have income, they can afford, they would pay less in rent than they would in the hotel. So we kind of started this Motel to Home. Didn't really know what we were doing. ProTeep and United Way were on board from the very beginning, and the city of Norcross is where we kind of started. We started with 12 families because we didn't really know what we were doing. We made it up as we went along, and we really started in January of 2020. Well, March hit and COVID, and we had 12 families that we were working with. We got very creative. We met in parks, we did a lot of Zoom things, but by the end of the year, all 12 were in housing. So we thought, okay, this works, we can do it. Now what? We need more money, more funding. So St. Vincent de Paul has been tremendous about finding the funding, finding money. We've partnered with Tommy and DeKalb during COVID funding. We've just kind of put this together as best we can. And now we have a really robust program. So in 2023, we housed 265 families. And that's, again, it takes a village. It's not just us. And what we found, wraparound services are key. So anybody can move somebody into a house, a home, an apartment. But our goal is to keep them there. We want them stably housed. That involves a lot of wraparound services. Families feel once they've moved in, great, everything's terrific. And no, they're actually just starting to get hard again. You have a water bill that you didn't have. You have an electricity bill. So we do a lot of budgeting. That is a key part of our program, is budgeting and continued budget. It's a 12-month program, so they have access to our caseworkers for 12 months. We try and mitigate as best we can. A lot of our families are hourly paid jobs. You know, Johnny gets sick, they miss a week work. Now we're short on rent. We try and do the best we can to puzzle things together. We use other nonprofits, other organizations to try and do our best. We've just started this year with United Way's assistance, a savings match program, which I'm very excited about. So families for 6 months, whatever they save, we will match it. And the goal is to create, I'm not interested so much in the number. If you can do $20 a month, great. It's to foster that habit of savings, because that's the key to staying out of homelessness. You've got to have some cushion. So our goal is, if they can leave our program and have a month's rent saved up, that would be terrific. That's kind of what we're aiming for. Also, a big push this year for myself, a motel to home. I really want to get into more workforce development. Jobs, income is key to staying stably housed. These are hourly paid jobs, a lot of them work. They're barely 50% AMI. It's not sustainable. They need support to be retrained. You know, so that's kind of where we're going. And St. Vincent de Paul, Georgia, this year, workforce development is a big push for us statewide. So I'm hoping to see some great results with that. I also want to shout out St. Vincent de Paul. Our headquarters are in Chamblee. We have a free to low cost pharmacy. So if anybody has medical needs, please send them there. We have a tremendous food pantry that's open Monday through Friday. It's a client choice. They get to shop in there. We also have on-site caseworkers now at that facility. So if somebody is literally homeless or looking for assistance, they can come in there now. It's been a learning journey doing this, and our biggest challenge, as everyone we talk about, is affordable housing. Safe, affordable housing. Yes, there are rents out there that are $1,000 or just below. I don't know that I want my dog living in them, let alone families. These are families with children. So that is a huge disconnect in what these folks' families are earning and the cost of housing. There just isn't enough affordable housing. We get between 80 and 100 applications per week. I would say the vast majority of them are earning below 30% of AMI. I can't help them. There's nowhere to go. So huge disconnect with rents, incomes, all of it. I look forward to making more connections. Again, it truly takes a village. I can only do my piece of it, and I'm always looking. It's a puzzle. Keeping someone stably housed is a puzzle, and we all need to put in that piece and stay connected. And I'm hoping that through these kind of meetings and we make connections, that we all can work together and really try and solve this problem for our families out there. Thank you.
Hello, everyone. Again, my name is Timothy Hardy. I am the Director of Code Compliance for DeKalb County. I got to tell y'all, almost feel out of place up here because the stories, the dialogue I'm hearing, it's great. Unfortunately, my position from a regulatory compliance standpoint is kind of the dirty but necessary part of the puzzle, as she would mention. So one of the things that my office does is we are tasked with coordinating cleanup efforts. We're tasked with identifying the different homeless camps or areas where they would, congregate or sleep. We have to identify whether it's private or public property. Once we identify that, then we have the challenge of dealing with the environmental impact of it, the community impact of it, the quality of life, not only for the homeless population, but the quality of life for the communities that they happen to be in. Usually, we're alerted to these different camps, tents, or areas, either by my friend Tommy over there in community development, or for the most part by citizens, community members who have some questions or concerns about what's happening around them. So you got to think about how this comes about, how they're actually living at the time, and the impact that it has on people around them. The business community, it's a huge impact on the business community, because some of the vacant business locations, or actually some of the occupied business locations, the homeless will take up residence near or somewhere on their property. Then we have the challenge of trying to relocate them, get them to move from one place to another, unfortunately, because that's what happens. It'll involve no less than 4 or 5 agencies at the time. That's my office, police department, community development, KDB, which is keep the cab beautiful, or sanitation if it's public space, and the trauma unit or the crisis unit for the police department. Because a lot of the homeless population that we encounter, have some mental health challenges, and that's part of that whole equation. I think the advantage for me being in this setting is just knowing all of the other resources that are out there and available to me. No, don't get me wrong, community development does a great job with offering services, but if I have, another list of name of agencies or contact numbers that I can, click into, it's more helpful. If I didn't have a direct line to Tommy Phillips or Alan Mitchell, I would be lost as to what to do, because we have to get it cleaned up. It's usually the property owner's responsibility to get it cleaned up. Once we have the homeless population or individuals move to another location, then there's the residual of it. There's all the trash and some of the other stuff you don't want to hear about that's left. So then we have to mobilize our contractors or sanitation to get those areas clean. The property owner or business owners then have to have some type of communication with police. There's the no trespass piece of it that we have to deal with. So while the focus is clearly trying to get the homeless population assistance, we still, for me, I have to think about the regulatory piece. I have to think about what effect it has on that business owner or that property owner that lives next door. So I'm just anxious to hear some of the solutions here today. But I have to continue to do my job. And to the permitting piece, I think maybe the issue you were trying to permit in Brookhaven, so maybe you should come over to CAB, and we might be able to help you a little bit more. But that's all I have. So welcome, happy to take questions.
Thank you all very much. So we've got some great questions that have come from the floor here, and again, we've just got a few minutes. We'll have some time at the end. We can cover ones that we don't get to right now. But one person was asking, what solutions are you seeing to address mental health issues in particular with those that you're serving in? How are you either approaching that, or what are you seeing in terms of needs in particular with where you're intersecting with these issues?
I'll speak to that question, but I want to piggyback off of the code enforcement piece, because one of the things that I like to put forward is behavioral economics, right? So it's not either or. Either we provide for our homeless citizens or we're attentive to the neighbors. It's both, right? It takes both of those to make up a community. And it's not a dirty piece that you have to do. It's a necessary piece, right? So our unhoused citizens have to interrogate their reality, right? Alan talked about, Tommy talked about their willingness to get out of the situation. So that's important. They have to be willing to interrogate their reality and ask why they're in that state and how do I get out? Because otherwise, all the services don't matter if they won't take advantage of them. We can transport them to frontline, but if they don't want to take advantage of the services, then we're at an impasse. So those are behavioral economics. And it's important for those of us who do the services, who are in the community, who are volunteers, that you talk that piece as well. It is not just on the service providers to provide the service. It is not just on the government entities to provide the finances or provide the structure. It is also on our unhoused neighbors or those at risk of homelessness. What are you doing about your reality? We're here to help you. I tell my clients all the time, I'm not going to outwork you, right? I will work with you. I will walk alongside you the whole way. But until they assess their behavioral economics, then we'll wind up in the situation where we have all the services, we have all the volunteers, we have the heart, we have the compassion, but we don't have the will to get out of the situation. And some of that is mental health, right? Some of those are related to mental health challenges. So that's a service piece, and so that service capacity exists. If they're in an encampment, they have to have that relationship with an outreach worker, the ability to be transported from that relationship that's developed to get to a service center where they can have those needs met, right? One of the challenges that COVID presented on HD was when you aren't able to go to have your needs met, your needs don't stop being a need, right? They have a negative impact on the rest of the community. So we're back in full scale now. So we have the ability, we have the service. We need to make sure that those who have the need, that the weight is not on them to get their behavioral health need met. Because if they could do that, then we would be out of business, right? And that's our goal, really, is to put ourselves out of business.
Anybody else want to speak to that? Okay, let me ask, again, we need to take a break in a few minutes. This is a question for Tommy. So you've got the microphone. So were you going to say something about, we'll let you answer both, but there may be others that want to address this question as well, because I think it's a broader one. Could you say more about the category or cause of homelessness that you described? Any estimates of how many people who don't trust going into shelters and need the support to begin to change their minds about that?
I don't have the exact numbers, but I think the visibility of what you see in DeKalb County is obvious when you start looking at going down to Cab Avenue. We had a young lady that's been there maybe 12 years now. She's been there a while. We just have to work with her. We have other people that we've been working with. We have another gentleman on DeKalb Avenue as a veteran. He's been there for a while. He's got his barbed wire up, twisting around the back of his area. We go in, we work with them, so we don't have the total numbers, but we're getting those numbers together so we know exactly where our cases are. We're putting that information together, so we will have a number for you in terms of the mental health situation similar to that we have. We had another young lady over in Scottsdale. She was evicted. She was on a bench for like 3 weeks. We worked with her for about 3 weeks to get her family, get her connected, her daughter and her son, to get her off the street. So we do what we need to do in terms of connecting services to these individuals on the street. We need more mental health services, which we're getting. We're going to talk a little bit later. We have another program coming online, and we don't want to take up all this time, but Home ARP is getting ready to come online, which has a lot of services, mental health services that we can provide. Alma Cooper, where'd she go? Alma's in here somewhere. There she is hiding in the corner. Hey, Alma, say, wait. Alma's going to have a program for us. It's going to help us with a lot of the mental health problems we have, with a lot of providers, with a lot of funding to get people off the street. So we're in the process now of bringing programs online that are going to address some of these problems and help some of our people with mental health issues to get them off the street, connected with services, and get them in shelter. Hope that answers your question.
Great, thank you. We're covering a lot of ground quickly, and so we don't have time to go further with this. However, I hope in the end we can come back and circle to some of these questions. Our schedule says that we've got a 10-minute break, and so use the restroom, grab some coffee. We're going to start back in here right at 10:40 for session 3, in which we're going to look at strategies for integrating some of these services together. So thank you very much to our panel. Can we give them all a hand, please?
You're welcome.
Thank you.
With the big thank you on it.
Mean guy, man. I don't mean to be. Hey, look. Let me talk.
can begin taking our seats. Let's grab our seats, everyone, if we can. We'll get started here in just a minute. Oh, I think it's solid. Oh, there he is. Yeah. All righty, please grab your seats, everyone. All right. Do I need to do any kind of mic check, or are we good to go? I'm looking at my friends in the back there. Tara, am I good to go, or do I need to? All right.
1, 2, 1, 2. Mic check. 1, 2. Mic check. 1, 2, 1, 2. 1, 2.
All right, welcome back here to session 3, where we are going to get increasingly tactical and strategic. How we get there, strategies on closing the gaps. And again, as before, we've got a great lineup of panelists here to be able to speak to this from their various perspectives. Again, as we did before, I'll just briefly introduce them. You've got their bios in your packets there. Maybe raise your hand as I'm going, because I don't think I've got it quite lined up in the order you're seated here, and then we'll start down here to take 3 to 4 minutes, as we did before, to speak to this issue from, again, your particular perspective. Jennifer Haynes Pruitt is a licensed professional counselor and the director of specialty programs for Claritel Behavioral Health, where she supports case management, supported employment, psychosocial rehabilitation, and peer support programs. Tiffany Patterson Henderson is the Homeless Veteran Outreach Coordinator for the Atlanta Regional Office of the Department of Veteran Affairs, having previously worked with the Veteran Benefits Administration. Salik Sohani serves as the Northeast Georgia Director of Outreach and Immigrant Affairs for Senator Warnock. Through this role, he develops and maintains relationships with Georgia's diverse immigrant communities and the region's city and county officials, nonprofit organizations, and business and community leaders. He works in close collaboration with communities across the region to ensure the Senator's office has meaningful presence in and across the region. Kenyatta Turner Burke is a housing advocate, and she lives in South DeKalb with her family. Amy Gray is a community planning and development representative for the Georgia Office of Housing and Urban Development, and prior to this she worked with FEMA in Washington, D.C. as a program analyst. And Tanya Smar is the community planning and development representative for the Georgia Office of HUD for the Housing and Urban Development, and with the community planning and development. She's been with HUD for a year and a half, and before this worked with the Department of Defense. So, again, great lineup of folks to be able to speak to these issues. Can we just start at this end and work our way down to address what you're seeing from your perspective?
Good morning, everyone. As the VA representative here, I am seeing a lot of homelessness that is occurring with the veterans. I have more than one theory, and I'm still working out some hypotheses, but right now I think the biggest problem that I face with dealing with veterans is they're not equipped structure. I go at this time. Well, when they come out to the real world, they're looking for that structure. First, and then, you know, they'll laugh it off, and some will say, well, he was really crazy. So, okay, we don't want to talk yeah, we don't want to talk about the crazy ones. But it is something that I am very concerned about, and battling is my passion. I cannot stand someone. My first question to any veterans, are you safe? Because that's what I need to know. You spent your life serving so that I didn't have to get out there and duck bullets and be shot and do PT and gas masks and all of these things that we need to make sure that we have soldiers that can defend our nation. So I am very happy to be here. Thank you so much for inviting me. But I guess my biggest takeaway from this conference is going to be that I need to encourage the veterans that you're just not the veteran homeless. There are other people that find themselves in your situation, and we're going to get help for everybody.
Good morning. Hello. Again, my name is Salik Sohani. I have the pleasure of serving as Senator Warnock's Director of Outreach and Immigrant Affairs. Like Jeff said, I have the pleasure of serving as his liaison in the state. And what that means really is I'm here to be the Senator's eyes and ears on the ground. And I'll be frank with you all, I'm pretty new to this role. I'm only about 3 or 4 months in this role, and I'm pretty new to homelessness as well, to this discussion as well. And to also be frank with you, I sort of feel out of place as well, because I'm coming from sort of the federal and the policy level as well, right? But I'm also not a policy expert by any means. And so for those of you all who would like to get connected with me afterwards, to understand more of the specifics of Senator Warnock's stance, which he's a very staunch advocate for unhoused individuals and supporting them in our state. Please get connected with me. I have many cards here in my wallet. If I don't have enough here, I have more in my car. I'm happy to get them for you all. Commissioner Patrick as well, again, thank you for having me here. He has my information. Tara has my information as well. But what I sort of want to generally say, because I know we're a little bit short on time, is, again, the Senator is a very staunch advocate for unhoused individuals. So much so that in fiscal year 24, last year, the Senator, along with his colleagues, was able to accrue $4.1 billion in homelessness assistance grants. And of course that's nationwide. Of course that's nationwide, right? But what's significant about that is that $4.1 billion was a $481 million increase from fiscal year 23 as well. So I know that a lot of things in the federal government may not be satisfactory to you all, but I want you all to know that you all at least have a senator and an advocate in Senator Warnock who does deeply care. You know, of course, there's always a political side of things, but as a reverend and as a man of the community, he does deeply care. And, you know, I'm here to, again, be on the ground to let you all know that I care as well. So if there's anything that I can do for you all, please do let me know. You know, again, it is a very nuanced issue as well. But, you know, I'm happy to provide more information about this. I'm happy to, and also, I just want to learn as well. Because like I said, I communicate to the senator. I communicate to our team across the state. So if there's anything that you all can teach me, I'm all eyes and ears. You know, please do let me know what I can do. And again, it's a pleasure to be here. Thank you to Commissioner Patrick for having me. Thank you again for your moderation. And it's a pleasure to be here. And also thank you to Mercer University for having us as well. Thank you. Take care.
Just go ahead and give out your phone number.
I can do that. I got y'all after the panel. All right.
Hello, everyone. I am Kenyatta Turner-Burke, and I'm a housing advocate in DeKalb. And actually, I've been advocating for more affordable housing since 2003, for landlord-tenant laws to be evaluated, policies and laws to be changed. And this is something I started in 2003, speaking in courtrooms, writing judges, writing city leaders, and it's a passion of mine. I worked closely with individuals facing homelessness by my work with different nonprofits, and I've seen the need for families to have transitional housing and shelter. I see much housing for males, they have transitional housing for males, but not much for families. There is a serious need for transitional housing and shelter for these families. And it saddened me when I worked as a lead case manager at Salvation Army, and there would be families with a lot of children unable to even get in the shelter. And it saddened me, and that's why I don't stop and I keep this work going, and I advocate anytime I can. I work at nonprofits that are passionate about homeless prevention. So I just feel like everyone needs to come together, businesses, churches, city leaders, partner with churches, and everyone come together, because it does take a village. And just the government can't just do it. We all need to come together.
Good morning. My name is Jenny Haynes Pruitt, and I represent Claritel Behavioral Health. Many of you may know it as DeKalb Community Service Board, so we have changed our name to Claritel Behavioral Health. Community service boards are the safety net provider of mental health and substance use services throughout the state. There are 22 of them. So we provide substance use, mental health, and developmental disability services throughout DeKalb County. And sort of how we fit into this, the unhoused conversation is, we are the provider of services. We have to go back to Maslow's hierarchy of needs, though, because if you don't know where you're laying your head at night, if you don't know where your next meal is coming from, there's very little chance that you're going to be able to actually address the mental health and substance use related issues that you have. And as other panelists spoke to earlier today, the cycle of becoming housed and then losing the housing constantly interrupts the connection to services. So that is also a large struggle that we see. We do offer connection to several housing related programs that are HUD funded and that are state funded, but I do want folks just to keep in mind that we are really a service provider, so the housing piece that we can offer or the connection to that is supposed to be secondary, but we're trying to fill a gap of helping people to achieve their basic needs being met so that we can continue on to provide those services. Thank you.
Good afternoon. I am Tanya Smar, and I represent HUD
off of Marietta Street, and our services are continuous services. We try to benefit the homeless by, one of the big things we do is the point of time, and you've heard that all morning long, point of time. And one of the things that we do with point of time is we just have volunteers to come out and say, hey, who wants to do point in time? I've done one, and many of my coworkers have. And it's very interesting to do point of time because you get an opportunity to see, either in the daytime or the night, how many homeless people there are out there, how many people are in tents, how many people are on the streets, and what their needs are, whether they're mental health problems, like she said, and whether they're just lost their jobs. Some people just have everything going for themselves, and then they just lose their jobs and they become homeless. So our point of time is very important because we can see the numbers, and we can see who's a family member, who's just an individual, who's young, who's old, who needs help. And that is the purpose of our point of time. So we do that every year in various different areas. And once we do that and come up with the numbers, then we can see what resources we can do to help these people. And one of the resources that we have, well, we have lots of resources, but one of them that we have is emergency services, which Amy will be talking about. But we also have all types of homelessness assistance programs. We have the continuing care program for chronic homelessness. So we put together a team of people every single year to come out with the point in time. And when the individuals tell us, yes, I've been homeless for X amount of time, our incentive is to give them a gift card, at least to get a hot meal on that particular day that we do point in time. So it's imperative that we keep account of all the people that we have and to make sure that these people can get the help that they need. And just like it's been said so many times before, the biggest problem is you can get the resources to the people, but it's very difficult for individuals to, you can't force people to get help. That's one thing we cannot do. You can talk to them, guide them to the right resources, but it's almost impossible to make somebody say, I want to go to a shelter, or I want to get mental health, especially with the veterans. Like we heard earlier, a lot of veterans have PTSD, and they don't know how to survive out here in the real world, not in the military. So it's very difficult to navigate all of the services that HUD has to offer. We have all types of assistant programs, emergency programs, but again, you can tell them this, talk to them, and it's still a never-ending battle. Thank you.
Hi, my name is Amy Gray, and I'm with HUD, and I just wanted to go over just a few programs that we have. The information that I do have is on HUD Exchange. Also, if there are questions that I have, that you may have for me or for CPD, which is the Community Development Department that I work in at HUD, you can just reach out to me or I'll provide some information at the end. The first program that I wanted to go over was the Emergency Solutions Program. This program actually, funds can be used to fund coordinated entry activities, and is also within the COC, which is a continuing care. There are also programs, Inspire. This is a federal registry notice. Also, this is the Economic Growth Regulatory Relief and the Consumer Protection Act. This notice here is until October 1st, 2024, and this is on our website at HUD Exchange. There's also information on there about training. There's online training, there's virtual and remote, and so all you have to do is just go on there and you just click on training, and then it'll navigate you to how to register, who to contact, and sign up for those trainings. And then also what HUD identifies as homeless, there are other things, but two I just wanted to talk about was domestic violence and rural homelessness. So there information on there and contacts for individuals to communicate with an effort with homelessness as well. And that's it.
Great. Thank you very much. One question that we have here that I think some on this panel could speak to is just a question in terms of helping folks with life skills. It's, you know, there's the hard skill component or the economic components, but the soft skills around folks who, this person says, many have never paid rent and so don't actually understand the importance of paying on time or having a budget or helping with deposits, these kinds of things. What are you seeing that has been helpful in terms of those soft skills, the life skills, working with your clients?
So currently, I'm a financial education program manager at BCM Georgia, which is a nonprofit as well. And we work, our program is called Budget for Life. And so what we do is help low to moderate income families properly manage and budget their money. And in return, we help them reduce their debt, as well as we also like to prevent homelessness. So what else we do is they pay debt, we pay their rent on a sliding scale. So we are seeing that this is really helping families. We've had families each session, over 1,000, 100 and some thousand families have paid off debt. So it's really working. It's keeping them in their homes longer, and we see that it's helping them learn financial management as well.
Super. Thank you.
One of the services that we provide is case management, and you hear that term or that service a lot. But our case management consists of not only linkage to resources and advocacy and coordination of their care, but it also consists of a skill building component where we work in the homes one-on-one with people on just those kind of soft skills. Even sometimes knowing how to keep your house, you know, how to do laundry and kind of basic things that we may take for granted. So that is a service component. But I echo what a lot of other people said. This is voluntary, it's choice. And so oftentimes folks will get connected to the resource and then they will disengage from treatment, and then again contributes to the cycle of becoming unhoused eventually.
Great, thank you. Tara, do we have other questions for the panel, or quick a card or a quick question from the floor that you want to ask?
Actually, we don't. We've been looking for them ourselves. So
We thought we would have it today, but we don't have it yet.
Any other questions for this group?
I have a question. So what do you think some of the strategies can be in order to kind of start the conversation around things that we can do in DeKalb County to tackle homelessness from your perspective?
Has to deal with just being open with the fact that homelessness anywhere is homelessness everywhere. As many of the panelists have said before, all of us, or some of us in this room, are just a few paychecks away from being the exact same people we're trying to help. So I think if we can start looking at it holistically and say, it's not just him or her that's homeless, that could be me. And what can I do, since I'm not homeless, what can I do to help them? Part of my due diligence dealing with the veterans is I provide life skills as well. Okay, so let's talk about this checking account. Let's talk about where you're going to live. Let's talk about what you're going to do when you get out the military. Because everything for me is, well, they did everything for me. I know. Jesus, we love them. But we can't do this for you right now. So I think a lot of it is just cognitively being aware so that you can offer valid solutions.
Are there any questions in the audience?
Sorry, if I could also follow up on that. So from a federal and policy level as well, I think there are also strategies that we can, that we on the federal level can take, and we are trying to take to address homelessness. And this was touched on in the previous panel as well, but it's about preventative measures as well. And a couple of sort of preventative focused legislation that was addressed in the previous legislative session in fiscal year 24, I'd love to touch on as well. Both of which Senator Warnock co-sponsored and signed on to as well. And hopefully y'all have heard of both of them. If not, please get in touch with me, and I'd love to get y'all in touch with our legislative team for more specifics as well. One is the YIMBY Act, the Yes in My Backyard Act. That was sponsored by Senator Ted Young, a Republican out of Indiana. Basically what that would do is increase transparency and shed light on discriminatory local zoning and land use policies. So that's sort of one preventative aspect of it, right? Because of course there are things that we can do within our control, but if we are renting and there is a predatory landlord per se that is seeking to take advantage of us and our neighbors, that makes it a lot harder already, right? So there are steps that folks within the federal government, Senator Warnock included, are doing to target those predatory landlords. So that's number one. Secondly is the Choice and Affordable Housing Act. This would essentially establish multiple programs and grants that would incentivize landlords to join the Housing Choice Voucher Program, such as a project-based Section 8 project that we also supported in the last fiscal year cycle as well. So those are just a couple of the things I wanted to touch on as well, and there's a lot more that we're trying to do as well. Just this year as well, Senator Warnock also signed on to a fiscal year 25, so for next year, legal assistance to prevent evictions letter. I know that's something that we were touching on as well. And he specifically asked for $100 million to go towards legal assistance towards evictions, right? So again, it really does take a village. It takes every single component from the federal to the state to the local levels. Again, really great that we're having this conversation here. And of course, really, really happy to see all the amazing work that's happening here on the ground. And again, thank you for this opportunity.
Let's keep your questions really brief, and we're going to do this in this panel here for just a minute, and then we're going to do a 2-minute stretch break, and then we're going to have a broader conversation with the various questions that are for all the panelists to have a bigger conversation. So let's do 2 quick questions. Just keep them very brief, and then we'll move on.
Yeah, very quick. A couple of you who are working with clients, case management, the issue of cell phones that these folks have. We got a word earlier, I think it was from Melvia, that, oh yeah, pretty much a lot of homeless people have cell phones. Those of us on the front line do not find that, and we also find if somebody loses or damages a cell phone, where in the world can they get one really fast? Are we aware of funding sources or organizations that could just meet that gap and provide a cell phone, not for 1 month, but if you break it, we want to stay in touch with you for 6 months, a year, 2 years.
And I'm catching eyes with Terry because I think Frontline does that, right?
When they come to the service center, they have a phone service there, they can get a phone right away.
Any limit on how much?
No, not a limit on the number of people, but they have the standard minutes that you get with those phones.
Good question. Yeah, absolutely relevant. Okay, let's do this. Because we've got so much expertise here in the room at so many different levels. So first, thank you to this panel for speaking into this. don't leave the room, but we'll stand up if you want. We'll do a 2-minute stretch break here, and then what we'd like to do is we'll get some of the panelists from before up here, but if the others who participated in one of the panels could be somewhere here in the front row, and because we'd like to be able to just have a broader conversation and be able to engage lots of people. So 2-minute break, and then we'll go from there.
Testing mic check. 1, 2, 1. 1, 2, 1, 2.
All right, let's get started here. And if we can have folks grab their seats up here and other panelists kind of be near the front here. Let's go ahead and grab our seats, everyone.
What about this one? What's this one? Testing, testing.
All right. Do I have permission from the powers that be to start? All right.
Yeah.
So again, a complex issue like this, one of the things we've recognized is, of course, how important it is to have people from so many different sectors to move out of the kind of siloed work that so many of us do and begin to have broader conversations. So what we really want to be able to do here is we've got some panelists up here, but we've also got, there's just not room to fit everybody from the last 3 sessions into 6 chairs up here. So we've got other panelists down here as well, and we've got microphones available. So we just want to be able to have a conversation, and if you've got something to speak to the questions or comments that are made, then feel free just to jump in, all right? I think, Tara, you've got microphones around.
Hello. I work with a local agency called Giving Grace, and we're getting calls daily about moms with kids that are sleeping outside. And this is something that's kind of new to me. I've usually worked in rent assistance and worked with the county a bit in helping people find rent assistance, but this is gravely concerning because we had a mom that was raped while her kids were right next to her while she was sleeping outside, and we got to help her get into housing, and then there was no rent assistance available to keep her in that housing. And so I want to know what DeKalb County is doing or plans to do, what concrete plans there are to increase shelter beds, because as far as I know, there's only 35 shelter beds in the whole county. And so, yeah, and also what does DeKalb County plan to do as far as more funding for rent assistance, because I'm here, raising money on my Facebook, not able to get in touch with any agencies that have any funding, so.
Great, thank you.
For rental assistance, we are starting a new program. We're waiting now for to complete all of the agreement pieces for agencies to start that program where it will be rental assistance. I think earlier I mentioned home ARP. While it will not solve all of the problems, it's only $7.8 million. But what we are looking to do is to have that work in collaboration with other things, other programs, with COC-funded programs, with things that already exist, to increase the rental assistance to people. To increase, there's also DeKalb County is also implementing a prevention program to help people who are in arrears on their rent and who are in jeopardy of being evicted, so that will work in collaboration or in cooperation with our rental assistance program. Additionally, in our rental assistance program, we are going to have the supportive services there so that that program will not just focus on paying rent and having someone be able to rent a new apartment, but have them be able to get the services, the job training, anything that they need, the health care, the physical health care, the mental health care, all of the services that they might need that might help them be stably housed. So they will have intensive case management, again, child care, transportation, just a number of services. The problem will be that is COVID-related money. That's a combination for prevention of ERA funds, for rental assistance, home ARP. And they're all related to COVID. So what happens when that ends?
Great, thank you. Right here.
I'm Don Anderson from Tucker First Methodist Church, and we've been for the last 7 years providing a cold weather shelter. And we every week on Sunday we have people come in and get their laundry done. They take a shower. They meet with us. They're part of our community. We got them on our cell phones. We try to get them cell phones when we get a cell phone. The big question is is the same one the lady asked a moment ago. How do we increase the number of beds for these people? These folks have come to us all through the winter. They're going to come through us all through the summer. I know their names. I got their phone numbers. Mm-hmm. But they're on the street, and they're not going to get off the street. And even when they go to COC, they're not there's not the beds available. And I've dealt with apologize for being on the soapbox, but I've dealt with COC, and God bless them. But they say we don't have the funds yet. Or our people we're contracting with don't have the funds with. And God bless Frontline, because I'm glad they're doing all this good work, and some people have gone down to Frontline. But affordable beds are the big question. So that's my question, is what can be done about affordable beds?
If I can answer that, and I don't want to give anything too definitive, but we obviously Frontline, from what we've learned, that's the path that we're moving down, because in addition to all of the affordable housing that everybody's talking about that is needed, there is two types of housing that is really needed, that emergency housing and that bridge housing. And that's really our focus. Again, can't get too far into it, but we're working with the county and the code and the permits to be able to be that place, on the front line while you're working to get rent assistance, while you're working to do those things, there's a place that you can go to be able to not have to stay out. It's a lot to put in place, but that's one of our big focuses over the next 6 to 12 months. Needed? That's probably a question more for continuum of care.
So let me just say that the commissioner needs to understand availability. So what we're going to do is make it visible as to how many people on our wait list for shelter. That's the question really you're asking, because the number of beds that we need is based on the number of people waiting to get in the shelter. So to be real clear, the continuum of care funds the shelter beds. We have the money today for shelter beds. There's not enough for the demand. So don't cloud the issue. When we get the money, we will increase the number of beds, but we don't have enough money to do that. So there's a misunderstanding about funds available and how we implementing those. So we implement the dollars we get for the continuum care and through emergency shelter, and we house people based on the funds that we have. So in any given day, we may have 200, 300 people on the wait list. We don't have 200, 300 shelter beds. So there's shelter for the immediate help, and then there's long-term support in terms of permanent supportive housing. So we're trying to look at the whole gamut. So I'll be remiss if I don't say right now, we have the continuum of care. Everybody in this room can be a member of the continuum of care. Just raise your hand. Then we can put you on the committees that we need to focus on shelter, street outreach, permanent supportive housing, transitional housing. We need people on our continuum of care to drive those things. So when we apply every year to HUD, that we get the money. So we need volunteers. And when I say we, the continuum of care, DeKalb County's continuum of care, you are all members of the continuum of care. You just need to sign up for a committee. And we can take care of that before we leave here.
Let me add to Tommy's answer and to Saving Grace's challenge that is repeated multiple times every day. Ending homelessness is not just, you don't go from the street into an apartment generally. Ending homelessness is a pathway, right? So we have to help them walk the path. There is the encounter where you find out what the need is, what the situation is, and then you try to get that need met with a resource. What Terry is working on and Frontline, what they're working on is that middle piece. The tip of the spear is the outreach team, or however they make that initial contact. That's the tip of the spear. The next point on that path is getting them connected with the resource that they need. Not just an emergency resource, unless when you affect that emergency resource, have a plan so that next month they aren't being evicted and that recidivism just continues to rise. And there are agencies out here, Home for Everyone in DeKalb, St. Vincent de Paul, a number of them can help with those emergency rental assistance issues. You have to make the call. Again, nobody can be all things to all people, but I want us to understand that ending homelessness is not a matter of one resource or multiplying the number of beds available or even multiplying the number of housing opportunities. It is a pathway, and we all have to do our piece in that pathway to help make sure that the need is met, it is met ongoing, and it is met in a permanent way where the person who initially had the need is also a partner in that pathway. And that's how we're going to do it. So we keep hearing we need more shelter, we need more shelter beds. Less of a reality than having a service center where there is a wraparound service component where there is a shelter bed there or a bed for the night, but they're not only getting the bed, while they're there, they're getting those services so that if they go back out the next day, at least they've had a connection with those service opportunities, that something on that pathway has been moved along. There's some progress. Won't be solved overnight, but they have to get on that pathway, and we all have to get our piece and that pathway moving, so that that person is not just back out there, so that they're not looking for another shelter bed. A shelter bed is not a solution. It is an emergency technique. Yeah, a stopgap.
Great.
So
Okay.
yes.
Lots of hands raised, so I'll get to you, but yeah, first back here. Uh-huh.
Yeah, that was a little confusing. I apologize to switch the subject a little bit, but I'll first say that I'm a social worker with the DeKalb Public Defender's Office, specifically the Behavioral Health Division, and we have most of our clients that experience homelessness before they come in and when they leave. And so what we are seeing is the DeKalb County Jail is becoming basically a shelter for our unhoused folks. And so I wanted to know if there's any initiatives already maybe that I don't know about or in progress, similar to like the policing alternatives in diversion program in Atlanta. We do have them come if they're already connected to our clients, but we cannot refer to them.
Anyone want to speak to that?
We are working with the sheriff's office. As we have in the past, and just a little history, we even once worked at one point with a judge where we had a case manager from our office who went in with the judge to see people in the jail who were there because their crime started with their homelessness. And we worked with them and with the judge. That was some time ago until that court was disbanded. But we worked with them to get them on to a good solution. And after they worked with to move on to get some other, the services that were required, then their record was expunged. We are now working with the sheriff's office, and I keep mentioning home ARP, and it is coming, but the sheriff's office does have an allocation there. And I know that they are working with CSB, they're working with other agencies, Caring Works, to take people out of the jail and get them appropriately housed. They have been working with Salvation Army before as well, but they do intend to have a program that will start this spring to work with people to get them housed appropriately out of the jail.
Great. Thank you. Right in front of you, if you can maybe just hand your mic over. Oh, yep, there we go. And then after that, right here.
I'm Greg White with the City of Decatur Parks and Recreation side, but I'm feet on the ground in the City of Decatur. I appreciate, first of all, us having this forum, but a couple things I just want to say, first of all, to the library system. The library system has been a wonderful place for unhoused. I just want to say, in which we work closely with, but one of the things for me is a couple things I want to say. Just thinking about, we're talking about how to get people to housing, but you have to understand a couple things. We have to be better with a policy. We cannot wait till 38 degrees and 35 degrees to move people. When we see that on nights, we had 61 nights, then what do we do with people's items? We have a whole storage issue in this county. As we move people, the recreation department got stuck with all the items. Fortunately, Terry being my catch, I had to get it out of the building, so we got all our items stored at Frontline. So the other piece of this would be, we think about cold weather, but last night, rain, cold, sun, rain, cold, sun. In front of the library, you had 20 people at the front door. Underneath the parking deck, you had another 20 people. So we had to address issues 24/7, 365. It cannot be cold weather, hot weather. People have so much trauma in this county as we see things. How do we address this piece? And the last piece, if you look at this room, piece that's missing to me is young people. I think college students working on PhD, master's degrees, young people with the technology, I think they can help us. They can do a lot. It took somebody to look at this space. A lot of times we're making space, and you also look at this space. Do we have any unhoused people in this space? You got to think about, let's hear from people who actually live it. Now it's a game changer. When you start living it, as they tell Miss White, it's cold, all my blankets wet. Everything I had, I got to throw away. They constantly calling, Mr. White, do you have a blanket? Do you have this? I know how to get some things, but this is people's reality. If it's code enforcement, I've thrown things away. But now the person got to start all over again. How can I begin to think about housing? How can I think about going to a doctor's appointment if I can't? I want to say the day center, now let's be quiet. The day center, 2 weeks ago, it took the impact off the library. The library could be a library. The recreation center could be a recreation center. The church could be a church. And our city commissions had an opportunity to breathe. So I think we have a solution moving in the right direction.
Great, thank you. Anybody want to comment on that? Okay.
I just think Greg, my chair of the board, is sitting right behind you, so I'm glad that he heard the impact of what that is.
Great, right here.
So George Dusenberry, also City Decatur, City Commissioner. I mean, we're all here because we recognize that we have a challenge and we want to be part of that solution. And so we all are trying to figure that out and do it. And I've heard a lot of like good ideas that have some limited impact or are moving things in the right direction. What I'm not hearing is what's the plan? I mean, as a county, what are we all trying to come together and do, and who's in charge of it? So that's what I think is lacking for that, because we as a city are willing to plug into that and to do our part. But we also recognize that we cannot do it by ourselves. We're 25,000 people, 4.5 square miles, but we're willing to roll up our sleeves, jump in there and do it. But where's the plan? Who's in charge? Who's getting it together? And the expert. I'm not an expert, but I really want to just plug in and do something.
Someone want to speak to
just
that?
Just an observation.
Yeah, if I could. So the whole purpose of this forum was to start the conversation. And I know some cities like Decatur have been sort of in the trenches, doing a lot of good work. This is an opportunity for us to learn from you. Of course, Mr. Alan Mitchell and his phenomenal resources is going to be critical at that table. But again, the idea is to start the conversation. We've seen a lot of the organizations that are active in the communities, and next steps we're going to be, let's sit down at a table. Let's find a structure and a process to move forward. And then from that, I can go back to the Board of Commissioners and say, we need to talk about getting resources allocated. Understand, the issue is larger than probably one county or one city. And really, at the end of the day, a lot of this ends up relating to mental health, and that is something where we're going to need our representatives from the state to bring in that money. I think the last I had heard there was a $16 billion surplus that the state has. It could be put to work in simple things like this right here, and I'm not convinced that it's going to take a whole lot of money. It is going to take money, but not $16 billion just to address us. So again, county commissioners, city elected officials, together interacting with our state reps. And we also have to address the reality, DeKalb is a very blue county in a very ruby red state. We need to build partnerships with people outside of the red, outside of the blue. If you talk with some of the commissioners in South Georgia and in North Georgia, it's the same issues. I remember talking with one commissioner. His daughter ended up working for the district attorney's office. She couldn't find a house. She's 30-something years old. She's living at home with her dad. If you go down to Glenn County, not to pull them out in particular, but I do read the newspaper down there. They've had issues with homelessness as well. I think they had last year adopted a panhandling ordinance. It's not a blue issue. It's a Georgia issue. And if we're able to build those relationships beyond our own delegation, so at the legislature as a whole, that's going to be part of the solutions that we need to be looking towards. DeKalb County can help, and we have the ability to make a financial contribution to this, but we do need our state partners. This is, as it gets into mental health, this is going to be a state issue that needs financing. So.
I'm sorry, let me piggyback off of Commissioner Patrick. So at the end of this, we are going to have a call to action that'll give you more information on what we can do next.
So if we can go, Tara, to this lady has had her, yeah.
Hi, my name is Rachel Frazier, and I am with Metro Atlanta Area Command Salvation Army. My question is, we talk about collaborations. Have we thought about collaborating with churches? That's one thing that I know that we don't see here. they may have some insight, may have some room, may have some resources as far as day centers. They may have, the capacity to hold when it's raining outside and it's nice outside. And I don't see that here. We use them when we want to distribute food, but we don't use them when they are needed here. I think that should be one thing that we do look at, because they can distribute food all day, but they're also getting the calls that families are in need of shelter. And my church in particular call me and say, hey, Frazier, what can we do? And sometimes I'll call Tommy, or I'll call Melvia, or I'll call my supervisor. But I think if we bring that to the forefront, they may be willing to assist. So the next time, if we can open that opportunity to religious entities, I think that would help as well.
Super. Anyone want to speak to that? Over here? Right behind you.
Hi, everyone. I'm Michael Bryant, and I'm the CEO of New Life Community Alliance and New Life Church. And we have been doing this work. We've been doing this work in DeKalb County for the last 22 years. We are a part of the COC. We work a lot with Melvia and Tommy and the team here. We provide not only the food pantry, we have case management, rental assistance, we have food pantry, as you said. We also have a barbershop, a beauty salon, a GED program. We have been very active in providing wraparound services. We partner in with Frontline now with our warming station that we provided. So the churches are this church is very much involved in this community, and we're open to working with other churches. There are some other churches doing the work. You just don't hear about them, but we are one and we're willing to teach and help other churches learn what we do. We've been doing this for 22 years, so everyone can't provide the same services we have, but you start small. And I think that's true of all the organizations here. We all have a niche, but we are here to partner with all of these organizations to share our wraparound services. We have a career service plan as well. So churches are involved. And Decatur Cooperative Ministries, I don't know if they're in here, but they are very much involved with getting churches involved in doing this work as well. But we're here.
Great. Super. Thank you so much. Right back here, and then if we can move a microphone down here as well, who's been waiting for a question. Yes, go ahead, ma'am.
Hi, and I want to say thank you to Commissioner Patrick. Nice to be here today. I couldn't wait for this session to start today. The things I have to say is I'm in Decatur. I got sick in Decatur, and I ended up on Sycamore Street. So I can tell you from here and from my experience of being homeless and no one to help. I sat on church pews, not one door open, the whole year and 5 months until I got well. But what I can say is that Frontline came around. And when Frontline came around, we had somewhere to go. They picked us up in the finest cars. We're riding in limousines to go to the shelter. We putting all our stuff that do not supposed to be in these limousines in there, and they still accepted them as if they were top line luggage. So I have to say, Frontline, you deserve a clap today. You deserve more than that. Not only have I had the experience of last year, this year I was there every day the door opened. And I just can't tell you enough how hard these people work. I can't tell you enough the services that they provide. I just can't tell you, because there's no lack when you're there. This last time, the pilot program is just so awesome, and I just hope it continues because we like to froze to death this week. Even though they said it wasn't cold, but along with the wind and the tornadoes, it was just a little bit more to deal with, okay?
Thank you.
But I'm not so much homeless. I'm here because God is healing me, and I'm on the other side. I stay out with them because I'm a certified minister myself, and that's what I do is outreach. So I am looking forward to signing up with some people to assist because that's what I do already.
That's great. Thank you. Right here.
Hi, good morning. It's Sherry with Blessing Bags of Warmth. Just wanted to point out one thing that I'd like to make sure is put on the table is when we start discussing ways that, you know, I love that we're discussing ways that we're going to move forward, but I want to discuss what we can do right now in the here and in between, and what little organizations like mine and Giving Grace and a few others that I've seen around the room, Mara, the helper just left, but us people that are out on the street daily, we are working with these families, these individuals, and when we pick up the phone to call someone, I had a situation just a week ago, actually about 2 weeks ago, where I had a mom with 5 kids, and I was instructed, hey, have them call the continuum of care, let's do what we can do, we've got room at the Hager House. Unfortunately, because of the requirement for a COVID test, because of the requirement for identification, because of these so many barriers, I lost the family. I had found the family. I had the family in my car. I was on my way to take them to get the COVID test. But what happens? It's now 6 o'clock in the evening. I can't get them I can't get a COVID test. I can't get these things. So I said, okay, I'll put you in a hotel, put them in a hotel for the night. The next morning, mom woke up to take the kids to school. I have now lost the family, and I've not seen the family for over a week. So let's make sure that's on the table, that us little guys that are out here that are doing the outreach, that are talking to the people. We're out there, we are on the phone with these people. I was out last night to 2 o'clock taking gas to a mom whose car had broken down because her and her 2 kids are sleeping in their car. She is on the wait list for motel to home. She's done the work. She's gotten her ID. She's gotten everything, but she's just waiting. So you have people out here like me. You have organizations out here. So make sure that's on the table. Hey, let's link in these little guys that are doing some of the other work.
Does anyone want to speak to that linking in piece?
Can I say just real quick, my name is Scott Hughes. I'm an executive director of a shelter that is not in DeKalb County, but we border DeKalb County, and I love just hearing what I hear. I sit on the board of New Life for the last decade, so I know that the churches and things are doing things in this community. My biggest accolade is I'm Tammy's husband, so that says it all right there. That says it all. But here's what I want to put on the table. Upstream thinking, like we're spending all our resources throwing life preservers to people who are drowning in a river, but nobody's going upstream to see why they keep falling in the river in the first place. I run a shelter where we spend the bulk of our time, the staff spends the bulk of our time parenting adults who didn't know how to budget or didn't know how. What is built into the program, or what are we considering upstream to prevent some of these things rather than just being so reactive all the time?
Good, thank you. Terry, do you want to speak to that? And then you want to hand the microphone 2 rows back to...
So there, and I'll mention this, and if anybody wants to get it, there's a study that the Brookings Institute put out called Middle Class by Middle Age, and you actually have to address this from birth to all the way to adulthood. Because if not, what you're going to have is that fountain of people continuing to come into that unhoused population because the child wasn't born to a mother that has a job and a partner at a normal birth weight. And then they weren't able to read at the 3rd grade reading level. There's these check-in points all the way through that you're going to have to address from a parenting perspective because they don't know that. And usually when we're working with a family, we have to work with both generations because if not, you're going to see that child coming back in at some point in time too. What we got to do is to get that work out to people and get those resources out to people to say, hey, as you're doing this work, here's some key performance indicators that you really need to look at if you want to prevent this second generation from falling back into the same thing that the first generation did. It's got to break the cycle.
Good. Yeah. No, sorry, I had him first.
Okay.
Yep.
Hi. I'd like to just applaud everyone in the room for just being here and doing what we are doing in this moment. Thank you, Mr. Patrick. Thank you very much, sir. And piggybacking on a component that you mentioned, we do have to incorporate the important actors on the table. One of the things that the Georgia public housing authorities have done is make a concerted effort to go out and get professionals. I never worked in nonprofit before 5.5 years ago. And as a former commercial lender with Bank of America and the partnerships that have been garnered working with people who have keys to units, we've got to reach them to and get them to the table and show them the profitability, maybe not on their financial statements, but from doing the right thing and all the benefits great relationships like this can yield. There are young people that housing authorities too. There are approximately 9 here in Georgia. We have a monthly meeting, and at our meetings we are talking about how do we, from our niche, our corner of the pie, contribute to make a difference. And that's why I'm here. We are trying to meet opportunities, needs more where they are, and we have young people. Someone mentioned, I think this young man here, getting millennials involved. It's mandatory. For those of us who have kids, my kids laugh at me all the time about how to be a better digital native. And, you know, they are being trained from medical school to law school to other areas of support that can make a tremendous difference in this homelessness value proposition. So I think getting the actors at the table is going to be mandatory. It's not even optional. And there are investors and landlord associations. One, we've been invited to the Georgia Real Estate Investors Association. Would love to bring some of this to them at their vendor fair on May 13th. So I was talking to Tara about how do we continue to move this forward as the housing authorities work to host sessions, following up on a health and housing coalition that the DeKalb County government is doing. How do we continue to connect the dots so that what Mr. Patrick is doing, what you all are doing, and thank God for you, we continue to do, and the stories that we can tell make the difference. Sure, we want our metrics, but when we can see the difference it's making in people's lives because of how their lives have changed, that's what we're here for. And there are a lot of folks willing to contribute to that, from business to red to other areas, including young people who want to get connected, don't know how. So let's think about considering them as actors at the table as well, please.
It's good.
And
Thank you.
If I can speak on that, Harold, as well. Well, first of all, I am a millennial, so that's the first thing. I think we got another one over there, right? I see you. I see you, man. I see you. And there, behind you. All right, so we have like five or six of us in here. So we're trying. Second thing I was saying is, I was speaking earlier about, and Harold, you were talking about, how do we incentivize these folks that they have the properties, right? And we're seeing this trend across Atlanta, right, where there's areas, and not just in Atlanta, in Gainesville, Savannah, you name it, right, where there's places and areas are just focused on development and money, right? But there are these properties out there, so just an idea I have, throwing it out there, and it's something that I'd love to move up to the chain on my end is, what if we can incentivize these folks, at least on the federal level? Like y'all have said, we have $16 billion surplus here in the state. Can we use some of that money to incentivize these landlords and these property owners to open up their spaces for the unhoused individuals here? On the federal level, can we do the same thing and incentivize these landlords, or provide an incentive program, sort of grant program or something that goes through the states or goes through the counties to these landlords and to these property owners to open up these spaces for for our unhoused community members as well. So it's something
Thank you.
I wanted to point out.
Thank you. Question here.
Yeah, I want this not to be a little bit of an elephant in the room, but this time of spring back in 2018, our beloved Department of Community Development put on a housing forum, all-day conference. Tommy, Melvia, it was an excellent event. Twice as many people here, brought in people from around the country with what are some expertise to kind of go in there. I know COVID hit, everything else going on. I think Melvia shared earlier, due to certain things, staffing for their department is limited. But I think the emerging question is, how can we guarantee that at least every other year we have a forum like this and it keeps going, and who is going to do that? Who initiates it? At what level? And so I think we have the complexity within the county. I will say one other complex thing for those of us who were really in August, we're getting desperate about planning for cold weather sheltering. Is, bless her heart, City of Decatur ended up pulling together people to say, let's get ready for cold weather. And we ended up doing it, and we still have some subcommittees of that group that are about now, let's evaluate how did cold weather shelter going. We were a little bit stunned to find out for DeKalb County, where's funding and who decides about cold weather shelter funding? It was our beloved Chief Cox. Not this department, but our emergency management department was given the authority by our CEO on this homeless issue. You know, let's have this other department. So we're still trying to figure that all out. And not that we need a decision today, but can we please plan multiple years and not have to reinvent the wheel?
Thank you for that. Do you want to answer that now or in your closing comments?
I'm a politician. I'll always
You'll take two shots at it.
and this is the political answer. I have a primary coming up. Let me get through that. We will be back, and we will keep up with this. Last year, we did a mental health awareness program for youth. My commitment is to follow through on that again this year. And this homelessness topic is we're going to continue working on this. Again, this is intended as step one. The next thing, and I'm going to say this in a few moments, essentially is we need to get everyone at a table. We need our leaders, our professionals that handle this, and start the coordination. Chief Cox, of course, Mr. Alan Mitchell, of course, the people up here on the panel. It's going to be an effort through coordination, and I intend to help out.
I'd like to make a couple comments, in fact, several comments. Because we've been doing this for decades, there are a lot of things that we've been doing that candidly you're unaware of. So I can point out, as you have questions, there are things that, they're good questions, but unfortunately there's a lack of understanding of things that go on. Maybe it's our fault because you're not communicating with you guys about what we do. But if you had something that you've been responsible for decades, you can imagine how much you've done. The question is, are you telling your story to let people know how effective you've been? In the county, and keep in mind, I've been in the county for 20 years, homelessness is important, but it's not something that elevates to the point where you see a lot of activity at BOCs, other meetings that are being discussed. However, we commit to HUD, we commit to everyone about what we're going to do. All the funding we get in community development comes from one source, federal. Okay, I'll say that again, federal. Everything we do is federal. My salary is paid by the feds, okay? The other thing we have is a preponderance of nonprofits, faith-based organizations that are working night and day to supplement what we do. That's evident by the people in this room. So we all know that you do good work. We have contracts with a lot of you to give you millions of dollars over the years. Some of the things you guys do are a function of funds that we get from the feds and we pass on to you. But what we have to do is get with Commissioner Patrick to see whether the county can make homelessness a higher priority to try to get funds from the county. Okay.
way that you can improve communication is with your website. So the community development website, if you search for DeKalb County and homelessness, there's a contact for Ann Zarko, who I understand doesn't work at the department any longer. And then there's reports from 2012 on the website. And so all the information that you all shared today would be really helpful to be on that website. When citizens of DeKalb County for 22 years are looking to see what is DeKalb County doing to address homelessness, to be able to go on the website and to see all the great work of the county and the nonprofits in this room and the individuals that are doing the work on the ground to bring things.
Yeah, so, thank you. So there's a lot of upgrades to the website, and we'll do that, because there are a lot of significant things we have underway. But keep in mind, the things we do, we write grants, we get a lot of funds from the feds, and we try to implement those programs. You heard several references to rental assistance. What about mortgage assistance? You probably aren't aware we got millions of dollars with various agencies providing mortgage assistance for people that could potentially have problems, that could become homeless because their mortgage is not paid. But that's obvious. Those programs are up and running. The rental assistance component, tenant-based rental assistance, will provide subsidy for people, sometimes a year, sometimes 2 years, for rental assistance. That's a good thing to prevent homelessness as you go over time. So there are so many programs that we have underway that we'd like to get into great details to explain. But the key factor is that the source of funding has to be enhanced. Last point, affordable housing. There was a comment made by affordable housing. The other thing we do is we use federal funds to provide lending to developers for affordable housing. So let me state that differently. Every affordable housing project you see, not all of them, we provide a gap funding for those developers. And as an agreement to have gap funding, they set aside units for individuals that are very, very low income, 60% AMI, 50% AMI, to allow those people to have units that they wouldn't be able to afford otherwise. And that, in effect, is a major contribution to avoiding homelessness. But every developer, we have a lot of developers that apply for us for loans. We've issued a lot of loans to developers. You're probably not aware of that. But that's another example where some of the housing projects you see going up, there are affordable housing units in those locations as a function of the work we're doing. The other thing we do is probably the Housing Authority is not here, but you're probably unaware that a lot of efforts are going on with the Housing Authority. There are over 10,000 vouchers that are in existence in DeKalb County. What does that mean? That means that there are 10,000 people, families, that are getting vouchers that subsidize their rent. Otherwise, they would be homeless. But you don't see those people. But all those housing projects you see around DeKalb County, they're being subsidized with federal funds that go to the Housing Authority. Not from the county, but we augment the Housing Authority. But the Housing Authority plays a major mission as far as affordable housing, because to the extent they don't get those fundings, and Congress does not appropriate funding for the housing authorities, those people with vouchers would be homeless. So there's a lot going on that's in the base that people forget. You might be myopic about, I saw someone last week and I couldn't help them because they're on the corner with a child, and what are you doing about it? You have to look at a broader picture, and that is there's so many things that are going on within the base that we take for granted. 10,000 people not being in the street with vouchers from the federal government is very important. Having substantial grants to people is very important. So I think you need to have a broader aperture. The school system is not here. You're here, but okay, you're here, but thanks for being here. But I'm saying that a lot of the kids today in high school will be homeless. Trust me, okay? They will be homeless because of their decisions. So what we need to do with parents and also the school systems is to prevent people getting to be homeless. Because to track for certain individuals in the school system, they're destined to be homeless. So we need to realize that they aren't homeless today, but they might be. There are people that currently are not homeless today, could be tomorrow's. So the broad comprehensive view would be to look at the interest for kids and look at people that might possibly be in the streets tomorrow because they don't get the proper services.
Thank you.
So I think that in conclusion with my comments would be that I need to work with Commissioner Patrick to get the county to focus on major capital contributions to be able to augment things. The day shelter that Terry has is not a bad idea, but we haven't been able to come to an agreement because the county is not in the housing business. Let me say that again. DeKalb County is not in the housing business. We don't own any housing at all, none. And most counties are not in the housing business. So therefore, you have to realize that if we get into the housing business, that's a serious step to get into there. We don't have shelters in DeKalb County. Should we have shelters? We discuss that daily. Daily, we discuss having a shelter. But today, we don't have shelters that are owned by DeKalb County. That's also a decision that has to be looked at to see whether administratively we migrate into the shelter business. But today, all the complaints we have, we don't have a shelter. I'll say it again. DeKalb does not have a shelter. Should we have one? That's debatable. And we should probably embrace it, okay?
Thank you.
So it's those kind of decisions, policy decisions, that have to be taken back with the help of Commissioner Patrick to the administration to see whether we can get a shelter per se to be able to augment some implementation of homeless prevention. So I say those comments to kind of level set things to make sure that there are things going on that you're unaware of, but there's a lot more that will happen by having provocative discussions with the administration and CEO to make sure we can get more of a focus on this key topic.
Thank you.
So, thank you.
Thank you so much. I think the questions just in this session alone underscore the complexity of these issues and how it's not going to get solved in just one morning, but that this is the beginning of a conversation that needs to go further. I'm going to give Commissioner Patrick the last word before letting you go, but before Commissioner Patrick comes up, can we first say a huge thanks to all of our panelists, both up here and who were earlier this morning. And can we say a thanks to everyone who is here, all of the commitment and expertise that exists in this room. Thank you for being here this morning. To wrap up, Commissioner Patrick, can I turn it over to you? Thank you.
We have talked about so many things this morning, and most of what I've said, I was already going to say, you've heard. Essentially, this is intended as the first step in a much broader conversation and a much larger engagement on addressing homelessness within DeKalb County. I want to thank Mercer University for allowing us to use their facility. I want to thank Dr. Bailey for being here. You left the cold weather to come to us, and we appreciate you for that. Thank you. But I also want to thank the panelists that are here, all the names that have been mentioned. Well, there was the screen up here that says it takes a village. It's literally going to take a village. All of us working together and coordinating together. I love DeKalb County. We plan things out perhaps to the nth degree, but when we execute amazingly. And so if you'll stick with us, give us some time. The plan is going to be to essentially get everyone here at a table and have a conversation on how we move forward. How do we coordinate? And again, Mr. Alan Mitchell with his input and his insights on what the county does that is sort of happening behind the scenes that we don't always see, that helps prevent things from becoming the bigger issue that they could be. We'll definitely need your insights. Again, everyone here on the panel that's been here, you are much appreciated. Thank you very much. I'm going to keep those to the end of my comments. I want to say thank you very much. It is 12:02, and as the former presiding officer, if you can end a meeting on a timely fashion, that's worth an applause. So thank you. Thank you, everybody. Kenyatta, thank you very much for putting this on the radar. I am grateful. Thank you. Thank you very much. Thank you, everybody.